The Committee on Education and Workforce will come to order. I note that a quorum is present. Without objection, the chair is authorized to call a recess at any time. Welcome, Secretary Becerra. Let me start by reviewing the OMB guidelines which govern your appearance before the committee today. When testifying, OMB Circular 811, Section 22 states, quote, "Witnesses will give frank and complete answers to all questions." Frank and complete. I emphasize this point because Acting Secretary of Labor Sue and your fellow cabinet official, Secretary of Education Cardona, have failed to be either frank or complete in appearances before the committee so far this Congress. I watched earlier this year when you were unable to provide frank or complete answers to the ranking member of the Senate Help Committee, Dr. Bill Cassidy, regarding questions about the Department of Health and Human Services, HHS, telework policy. I hope you've come prepared with more adequate responses today. Being forthcoming in your testimony and in answering the committee's questions is not only important to our duty to conduct oversight, but also because the HHS budget is the largest in the executive branch. The President's FY 2024 budget request calls for a massive $144.3 billion in discretionary spending and $1.7 trillion in mandatory spending. And my colleagues know I hate those two words as being distinguished, but that's the way they're dealt with in our system. For context, 1 in every $4 taken from taxpayers by the federal government is routed through HHS. It wasn't until the last 10 years or so that the word trillion became a part of everyday budget parlance. It's a worrisome trend. Budgets calling for more money and reckless spending are crushing everyday Americans. We've seen the inflationary effect of this administration's $5 trillion of deficit spending reflected in $4 for a dozen eggs and $4 for a gallon of gas. Each dollar matters when wallets are stretched thin. So the enormous HHS budget requires a critical eye. Our oversight duties can be summed up in 3 rhetorical questions. 1, are you being a good steward of taxpayer money? No, Mr. Secretary, this administration has drastically increased the burden on taxpayers by quietly but steadily moving enrollees from the small group market to Obamacare exchanges and Medicaid. The budget calls for the permanent expansion of Obamacare's advanced premium tax credits, which would lead to 1.6 million employees losing employer-sponsored coverage and costing $247.9 billion over a 10-year span. The all-out assault on employer-sponsored insurance is costly, but it's also the Trojan horse for Medicare for all. Though most workers like their employer-sponsored insurance, these plans are dwindling under the Biden regulatory scheme. Now, employee-sponsored coverage represents under half of all plans, and fully socialist health care is all but certain if Medicare and Medicaid enrollees reach critical mass. Second, your regulatory scheme is hurting the taxpayer. But are your policies promoting a healthier America? Again, the answer is no. At the southern border, HHS has endangered countless minors through unaccompanied children program, then covered it up through whistleblower intimidation. This means HHS knowingly transferred these children to the possession of others who were not their parents without ensuring that the child was healthy or that the transfer was necessary. Ultimately, this negligence may have contributed to the deaths of at least 2 migrant children in the past few months, which the committee learned about through reporting by Fox News and CNN. It's troubling that HHS did not think this tragedy warranted a phone call. And lastly, your policies are not promoting a healthier America, but are you committed to upholding the constitutional rights of all Americans? Strike three. At least not with the respect to the First Amendment, which protects Americans' free exercise of religion. From the beginning, Secretary Becerra, your record has shown hostility towards faith-based groups. In fact, the only healthcare experience you had before assuming office was litigating an appellate court case in which you attempted to strong-arm Catholic nuns into paying for others' contraceptives. You've carried the very same disposition toward religious liberty into your role as secretary. Tooth and nail, you fought religious groups by threatening them. St. Francis Health Systems knows. You threatened to remove its Medicare accreditation if it did not extinguish the living flame in its chapel. That is not to say that HHS serves no religion. Rather, antagonizing faith-based organizations is merely an attempt to smuggle your department's pseudo-religion through the back door. Mr. Secretary, HHS serves the civil religion of progressivism and radical gender ideology. Minors are undergoing irreversible sex change operations in this country, operations that you encourage with your rhetoric and funding. Radical gender ideology is not a marker of a healthy country. On every axis, anxiety, depression, suicidality, self-harm, you name it, these children are unhealthy and in desperate need of a society-wide fix, not individual genital mutilation. In 1787, Thomas Jefferson wrote, "Without health, there is no happiness, and attention to health, then, should take the place of every other object," end quote. So in the spirit of Jefferson, let's recognize and remedy our national mental health sickness. It seems to me that it's the worst where and when radical gender ideology is most pervasive. Maybe, Mr. Secretary, we should start there. With that, the committee looks forward to your direct, frank, and complete answers, and I yield to the ranking member for his opening statement.
Thank you, Dr. Fox. Secretary Becerra, good morning. And thank you for being with us today. And it's always a pleasure to welcome you back to the committee. You are familiar with this room. You and I began our congressional careers in this room 30 years ago, and it's a pleasure to see you back. And also a pleasure to see you discuss your work as you protect our nation's well-being. One of the enduring lessons reaffirmed during the COVID-19 pandemic is that when we invest in the health of our communities, we provide people with the tools and resources to care for themselves and their loved ones. Under your leadership, the Department of Health and Human Services made historic investments to help every worker and family get quality, affordable health care. Last Congress, we passed the American Rescue Plan Act, which you had a lot to do with. It enhanced premium tax credits to lower monthly costs for Americans, especially by eliminating the subsidy cliff so more individuals could get affordable coverage. We also passed the Inflation Reduction Act to extend these tax credit enhancements, cap the cost of insulin for people on Medicare, and for the first time ever, direct the federal government to negotiate lower prices for prescriptive drugs covered by Medicare. These decisive actions have yielded results. Last August, we brought the portion of Americans without health insurance down to the lowest level ever. During the most recent open enrollment period, a record 16.3 million people signed up for marketplace coverage. We also know that protecting our nation's health goes beyond improving access to health insurance. And that's why last Congress, we also secured House passage of legislation to prevent child abuse, address domestic violence, and lift people out of poverty. Unfortunately, while my colleagues on the other side speak frequently about their commitment to our nation's health and safety, they have not backed up their words with actions. For example, my colleagues may talk about child labor today. However, the reality is that they sought to hold our nation's full faith and credit hostage and threaten severe cuts in federal resources that protect children and prevent abuses from happening. The Republican state legislators all over the country are working to reverse child worker protection laws. And despite our letter requesting a hearing on this persistent and growing problem, the majority has yet to schedule a hearing or advance legislation to address child labor violations. Instead, we've seen Republican politicians continue to attempt to sabotage quality health care coverage and undermine access to services that our constituents need. The nation is witnessing the harsh restrictions and criminalization of women's access to abortions, jeopardizing the health of women and families across the country. We are all bearing witness to the baseless villainization of unnecessary care that supports transgender individuals, and you heard some of that just a moment ago. Earlier this year, the federal judge in the Fifth Circuit, who previously tried to eliminate the Affordable Care Act before it was upheld by the Supreme Court, ruled to strip millions of Americans of access to preventive health care, and thankfully that ruling has been temporarily suspended. Just last week, the committee majority voted to report out two bills that increase health care costs for vulnerable Americans by expanding association health plans and blocking state and federal consumer protections for stop-loss insurance. In contrast, the committee Democrats and congressional Democrats and this administration will continue working to lower prescriptive drug prices, strengthen the ACA, and improve transparency for health care consumers. Committee Democrats remain focused on how this administration can help build on our progress to ensure equal access to care for our most vulnerable communities, meet the changing health care needs of families, and lower the cost of quality health care and community support. The administration's proposed investments underscore your commitment to protect the health and well-being of every American. So I thank you, Secretary Becerra, for your work and for joining us today, and I look forward to our discussion. Thank you, Madam Chair, and I yield back.
Thank you, Mr. Scott. Pursuant to Committee Rule 8C, all members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m., 14 days after the date of the hearing, which is June 27, 2023. Without objection, the hearing record will remain open for 14 days to allow such statements and other extraneous material referenced during the hearing to be submitted for the official hearing record. I now turn to the introduction of our distinguished witness. We have before us today the Honorable Javier Becerra, the Secretary of the U.S. Department of Health and Human Services, and as Mr. Scott mentioned, a former member of this committee. We thank you for being here today and look forward to your testimony. I remind the witness that we have read your written statement and it will appear in full in the hearing record. Pursuant to Committee Rule 8D and committee practices, I ask that you limit your oral presentation to a 5-minute summary of your written statement. I'd also like to remind the witness to be aware of his responsibility to provide accurate information to the committee. And with that, Mr. Secretary, I recognize you for 5 minutes.
Chairwoman Fox, Ranking Member Scott, and members, thank you very much for this opportunity to testify. I understand that CDC Director Dr. Rochelle Walensky is also testifying at an oversight hearing this morning. Dr. Walensky helped lead our unprecedented whole-of-government response during this historic pandemic. We are living our lives again, and the American people are safer now because of her leadership. Under her direction, we began the critically important work of modernizing our public health infrastructure. She leaves the CDC better positioned to respond to future threats. Working alongside Dr. Walensky as a partner and friend has been an immense honor. As she prepares to leave later this month, I wish to publicly thank her for restoring, in no small measure, the health of America. Now, let me offer a few data points as we prepare to discuss the President's 2024 budget and investments. Today, under the President's watch, more Americans have access to a doctor or a hospital through their own insurance than ever before, more than 300 million, and 16 million, another all-time high, have it through the Affordable Care Act. The President's new lower-cost prescription drug law is already working. Today, insulin costs only $35 per month, and preventative vaccines like those for the flu, COVID, and shingles are free under Medicare. And soon, we will finally begin to negotiate to lower prescription drug costs. We have effectively implemented the largest adult vaccination program in U.S. history, achieving close to 700 million shots in arms to tackle COVID. And finally, HHS has successfully launched and expanded 988, the 3-digit suicide and mental health crisis lifeline. We have added text and chat capabilities, lines that are dedicated for our veterans. We have added language support options. Millions of Americans have since reached out for life-saving help using 988. Our aim is to build a healthier America by moving the nation from an illness care system to a wellness care system. An illness care system leaves our most vulnerable families behind. A wellness care system invests in providing the full spectrum of health care to all Americans. Illness care allows the price of prescription drugs to skyrocket. Wellness care would seek to negotiate for the best price for prescription drugs and treat nutritious foods as medicine. Illness care requires you to get a referral to a specialist from your own family physician in order to secure mental health support. Wellness care lets you get that support the minute you walk through the door of your family physician's office. Illness care, well, it forces hardworking Americans to deplete their life savings in their later years in order to afford the long-term care and support they need. Wellness care advances long-term care and invests in in-home care so older adults and Americans with disabilities can thrive at home in their communities. The President's FY 2024 budget builds on our successes and moves us closer to a wellness care model. The budget invests in better preparing America to tackle the next public health crisis and keeps us in a ready position to confront a COVID resurgence. On mental health and substance use, we build support for crisis care services. We invest in growing the behavioral health workforce, and we dedicate resources to combat fentanyl and opioid addiction. The President's budget strengthens Medicare for the next generation. We also take care of our family members in this budget by investing in child care and preschool programs and by strengthening Medicaid home and community-based services. Americans will appreciate that the President drives forward funding for the Cancer Moonshot and ARPA-H's investments in cutting-edge medical innovation. And his budget protects and bolsters Title X family planning programs so essential to so many of our families, and it honors our responsibilities to Indian country. Through his FY 2024 budget, President Biden once again delivers on his promise to the American people to lower health care costs for more Americans with better benefits. I am very much looking forward to working with every member in this committee, and I look forward to your questions today. Thank you.
Thank you, Mr. Becerra. Under Committee Rule 9, we'll now question the witness under the 5-minute rule, and I recognize myself for 5 minutes. Mr. Change of plans. I recognize Mr. Wahlberg for 5 minutes.
Madam Chairman, thank you for that opportunity. Secretary, welcome back to the committee room.
Thank you.
We had the opportunity to serve together on this committee, and appreciate you coming back. However, before I go into my main questions, I would be remiss in not at least letting you know my concern as the position you're in, given that position by the President, confirmed to be in the position. I would have to say that what's going on with our children, regardless of the adults, what's going on with our children right now, I would believe, contrary to science, and we've been told for the past several years to follow the science, follow the science, follow the science, so many things. But what's being foisted on our kids these days, relative to things we wouldn't have countenanced just 3, 4, 5 years ago, and suggestions about their sexuality and gender, etc., is gravely concerning to me, and we probably can talk about that some other day. But it's a great concern to many parents and adults who care about kids, their lives now and for the future. And so your position has much to do with that and making sure a generation moves that will be productive, healthy for the future, and living according to science and nature itself. Mr. Secretary, in April, the New York Times published an article detailing the horrifying reality that unaccompanied migrant children were being released from HHS custody to sponsors who are exploiting them. The lack of coordination between the Department of Labor, the Department of Health and Human Services, and the Department of Homeland Security described in the New York Times piece is alarming. It's the responsibility of HHS to ensure that these children are placed with responsible caregivers after they leave HHS. Yet it appears as though many of these children were placed with human traffickers and were forced to work in dangerous jobs. Did the Department of Labor warn HHS that these children were at risk for human labor trafficking at any point in 2021 and 2022?
Congressman, first on your earlier remarks, I appreciate the way you posed that, and at some point perhaps we'll have opportunity to discuss that type of care that Americans are receiving and need. On this particular question, let me again thank you for the way you posed the question. First, to point out that we are working closely with the Department of Labor to try to coordinate where we can. We don't have jurisdiction over the kids that are in the hands of sponsors. What we can do is work with labor if they find that there are some markers, signs that perhaps there are certain employers or companies that are violating child labor laws. So what we do is we try to work with them. But this is not one of those cases where we are able to monitor a child who has been placed with a sponsor.
But do you think, I understand it's your responsibility to vet sponsors. Do you think they were properly vetted, these unaccompanied minors who were eventually found to be exploited by human traffickers?
Congressman, yes, and let me tell you why the answer is affirmative. Virtually all of these, well, the vast majority of these children are placed with either the parent or a close family relative. They all go through background checks. We continue to do the checks that you would expect to make sure that if you're going to place a child in a particular home, that they will be safe.
But how did this happen then? If that is the policy, how did this happen that they ended up being human trafficked?
Yes. What I would tell you is that I think the evidence points to is the fact that we have, unfortunately, unscrupulous employers and companies that are willing to take advantage of some of these kids. Not all of them are migrant kids, by the way. There are some U.S. citizen kids. But clearly, migrant children are more vulnerable, and what we see is that they are being taken advantage of by some of these employers. And I hope that we all work together to try to get to the bottom of this.
Well, I would hope so, because it appears that you had the opportunity to return these children to immediate relative or an original sponsor, and ultimately the vetting wasn't done, and they ended up being human trafficked, and that was under your watch.
Congressman, we did the vetting that showed that whether it was a parent or an older brother or sister or an aunt or an uncle, if we can't place them with a close relative like that, then it would be very, very difficult. There are far fewer number who are assigned to someone who's not an immediate or close relative.
They ended up being human trafficked. That's my concern, and we're expecting you, your agency, to make sure that that doesn't happen. And this was the New York Times bringing out this issue. So please help us on that one.
We'll look forward to working with you.
I yield.
I want to ask members to not start questions in the last few seconds or to continue speaking. If the witness is speaking, I'm tolerant of that. But I don't think members should keep speaking so that we can get through the hearing as quickly as possible. Mr. Courtney, you're recognized for 5 minutes.
Thank you, Madam Chair. Mr. Secretary, good to see you here again today. And, I would just begin by just saying, for all the talk that our friends on the other side in the majority about, the problem of inflation, which is real for the American people over the last 5.5 months, in majority, they've actually contributed absolutely nothing in terms of real policy that could make a difference. Just a few minutes ago, the Bureau of Labor Statistics just announced their latest inflation numbers. It shows that inflation dropped to 4%. That's the lowest number in 2 years, 11 straight months. Again, we've got more work to do. And one thing that this Congress could do is to follow on the work of the Inflation Reduction Act regarding prescription drugs. As we all know, starting on January 1, because of the Inflation Reduction Act, the cost of insulin was cut by 2/3 for people on Medicare, which was authorized by that law. But what's not maybe as well known is that just a week ago, you announced more savings with a provision in the law requiring drug manufacturers to pay rebates to Medicare if the price of the product rises faster than inflation in Part B and Part D. HHS last week released a list of drugs in the Medicare Part B system for which drug manufacturers increase prices against the law, and that means that those drug companies have to pay rebates, which, according to your statement, could mean for patients and seniors up to $449 per dose of savings for 43 drugs. Now, if we wanted to do something about inflation in this committee, we could extend the benefits of those price negotiation rebates and insulin reductions to employer-based health plans, which we passed in the House when the Inflation Reduction Act came out of the House. Unfortunately, that was stripped from the Senate. So could you talk a little bit about the rebate savings? And again, there's a golden opportunity for us to extend those savings to working age Americans through their employer-sponsored health plans.
Congressman, absolutely. Everyone is now familiar with the $35 for a month's supply of insulin. Great news. Great news. By the way, I hear more from seniors about the shingles vaccine that is now free than about anything else, because the shingles vaccine could cost you $200 or $300. And for a lot of seniors on fixed income, that's not doable. Worry about getting shingles, because it is not fun. It is very painful. And so it's great that it's zero cost. But what we just announced is that we found that there were 43 drugs that pharmaceutical companies were putting out there where these companies had actually increased the new price more than the rate of inflation. And because of the new law that you all passed, we now have the ability to go back and say, you can't do that. If you try to increase the price beyond the rate of inflation, we get to pull back the excess and put it back into Medicare, so it'll provide savings to those Medicare beneficiaries.
And again, just to the point about our ERISA jurisdiction in this committee, I mean, there is nothing that really justifies not extending that same benefit to people who are not in Medicare. Isn't that correct?
That's right. In fact, we saw that companies, because the president pressured them, said you should be able to do $35 insulin, not just for those on Medicare, but for every American. And today, that's what we're seeing.
I'm glad you mentioned that, because you're right. A couple of the large drug manufacturers who produce insulin were almost shamed into, again, matching the $35 cost for seniors under Medicare. Again, this was a drug that had been off patent for over 100 years, and there was no justification for the overpricing that took place. So again, I hope, again, as the fruits of this law begins to, again, become more and more apparent to my colleagues, that we will revisit this issue of, again, extending this benefit so that, again, private health plans that provide insurance for people of working age in employer-sponsored settings will, again, also benefit from lower costs, helping reduce inflation in a really critical area which people depend on for life-saving medication. So I want to congratulate the department for their successful and swift implementation of the Inflation Reduction Act rebate program. With that, I yield back.
Thank you, Mr. Court. And Mr. Grossman, you're recognized for 5 minutes.
First thing I'd like to submit for the record, Administration for Children and Families, OR Field Guidance Number 10 and Field Guidance Number 11.
Without objection.
Thank you. Last week I met with a young gal, 15 years old, who unfortunately let herself get tied up with what is quickly becoming the medical establishment. She had been on, I think, testosterone and puberty blockers, wound up getting her breasts cut off at age 15. Now she just feels horrible about that. To a degree, she feels she's made fundamental changes in her life, and she's never going to be able to live a normal life. I've also read a book, When Harry Became Sally, by a guy by the name of Ryan Anderson, which talks about the horrific long-term effects of these type of gender, what I guess you guys would refer to as gender-affirming health care. Mr. Secretary, what are puberty blockers?
I'm sorry, Congressman.
What are puberty blockers?
Congressman, there are a number of medical treatments and services that are provided to Americans to fulfill their health care needs.
Yeah, what effect do they have on brain development? Do we know that?
Well, based on the recommendations of a physician, an individual would be recommended for
Yeah, I
certain
know.
types of medicine.
Do we know, have we done like studies over a period of 20 or 30 years? So we know the long-term effects of puberty blockers on kids. Seems to me a very significant thing that I would never allow anybody who was asking for my advice ever to take. What is the long-term effect over 20 or 30 years?
Well, there is scientific and medical evidence with regard to the practice of some of these medicines. These are treatments and
Where's that
therapies.
evidence?
There are a number of medical journals that we could cite you to. There are a number of physicians who've been providing gender-affirming care for quite some time. Most every major national medical association supports gender-affirming care, and so it's not new. It's been around.
Isn't it true that on some of this stuff, Scandinavian countries, Dutch countries, at one time recommended this and they don't recommend it anymore?
I'm sorry, who did not?
Scandinavian countries and the Dutch.
Congressman, I could tell you about America. I'd be out of my lane if I tried to
Doesn't
tell
bother
you
you
about
that European countries at one time used these and now are backing off?
I think we have some of the best medical professionals in the world. We do some of the best research. I trust the medical judgment of those who are experts in this field.
Okay, I guess I'd ask you to familiarize yourself with what's going on in other countries and see why they're backing off this sort of treatment. Next, are you familiar with studies that show, increased levels of suicide, depression going with people who take these puberty blockers, and much less people who have surgeries when they're 15 years old?
Congressman, we can talk about a lot of the research and the data. I will tell you that what we know at HHS is that many of the transgender youth that are having very difficult, traumatic times find that getting gender-affirming care has been helpful in
And that means
their lives.
you stand behind the idea of a 15-year-old girl having her organs removed. You think that is, under any circumstance, appropriate? 15?
Congressman, you're asking questions that are issues that are made or judgments that are made by that individual patient with that patient's physician, a medical expert,
She's
not a politician.
15. I know she's making the decision. She was 15. Doesn't that mean anything to you? You think this is appropriate for a 15-year-old?
It means a lot to me that a medical professional is the one guiding that patient's decisions, not a politician, not a bureaucrat.
Okay. Want to switch really quickly to ORR and the type of people who are becoming sponsors. Frequently these people are becoming sponsors, claim to be relatives of some nature. Do you ever do DNA tests on these people to assure that they're related if they claim they're related?
We do a number of background checks. We include fingerprinting.
You do DNA tests.
We do background checks, and we do them
That's,
the way
that
they
means
have.
no?
That doesn't, I can tell you what we do.
Yeah, that's what I want to know. Do you do DNA tests?
We do background checks that include fingerprinting. We
It's
check.
just a yes or no question. Okay, I know that at the southern border, the Border Patrol does DNA tests sometimes if somebody says. I gave you a yes or no question. You have the capability of doing DNA tests. Do you do them or not?
Mr. Grossman, I think the witness answered your question.
No, he didn't
Miss-
answer the
Well, he did.
question.
He didn't answer it, so he answered it. Ms. Wilson, you're recognized for 5 minutes.
Thank Thank you, Chair Fox and Ranking Member Scott for today's hearing. Secretary Becerra, my friend, we miss you, but it is great to see you today. Congressional Democrats, with the help of HHS, have been working to expand access to quality and affordable health care. Florida led the nation in Obamacare enrollment for 2023. More recently, I have successfully fought and gotten resources to build new clinics and expand access to primary care and dental care for children in my district. I have proposed legislation that places a registered nurse in every school and provide additional resources for HIV and AIDS patients in Florida. These actions all demonstrate Democrats' dedication to accessible health care. I look forward to working with you, Mr. Secretary, to address health disparities, a woman's right to choose, the nurse shortage, COVID services to our underserved minority communities. And I want to extend an invitation to you to come visit Miami so that we can work closely together. I would love to have you. So that's on the record. With that, I have a few questions, and I have so many questions, I'm going to ask them all and let you answer. Okay, how about that? How are you working to protect 340B programs to ensure community health centers can continue to serve our communities with the end of the COVID funding? And Medicaid redetermination, can you work with our state to improve the process and address the Floridians who lost coverage because of their redetermination? COVID funding. We have a group in Miami led by Dr. Dwight Reynolds. It's called Centers for Health Promotion. How can HHS help this coalition continue their work to provide COVID-19 vaccinations, treatment, and education to the African American community in South Florida, and gun violence? Gun violence has been the #1 killer of black men and boys between the ages of 15 and 44. In 2006, gun violence became the #1 killer of black children, and now gun violence is the #1 killer of all children. What is HHS doing to address gun violence? Then health disparities in black men. What is HHS doing to address these preventable health issues for black men? Heart disease, stroke, and other preventable illnesses. And also in 1978, there were 1,410 black men in medical school. Now there are 690. And has your agency worked with the American Medical Association and NMA to address this disparity? Thank you. I have some more, but I'll run out.
Congresswoman, let me do the best I can to try to respond to as many of those questions as possible. But first, I will respond to your comment, and I publicly can say to you, I look forward to being in your district and meeting with folks who are desperate to make sure that we continue to offer them affordable health care, quality affordable health care. So I look forward to the invitation to come visit in your congressional district. 340B, As you know, it's a critical drug discount program for safety net providers. Without the 340B program, a lot of those community health centers that offer tremendous services would not be able to make reasonably priced pharmaceutical drugs available to so many people. And so we understand the importance of it. It's a big tug of war right now. I know you know this, and we're going to do everything we can to enhance transparency in the way those middlemen operate. We want to make sure that those who are operating these 340B programs and determining which health centers are able to get access to the 340B program are doing so in a way that complies with current law. We also want to make sure that any of the savings that are being generated by the drug discount program are actually going back to the American people, and so through lower priced drugs. And so there's a lot of work we need to do there. But as you know, many of those who operate in this space use the courts to try to protect themselves from full disclosure and transparency. So we're going to do what we can. The president's budget does propose an increase, $17 million, so about a $5 million increase to be able to actually strengthen the program's operation. Redeterminations on Medicaid, I hope we can all work, every member here can work with us. We just sent out a letter to every governor in the country saying we need to work on redeterminations.
Thank you, Mr. Secretary, and thank you, Ms. Wilson. Mr. Allen, you're recognized for 5 minutes.
Thank you, Madam Chairman, and thank you, Mr. Secretary, for being here this morning. I've got a lot to get through here. Right now, private health insurance in this country is virtually non-existent, as the government is currently driving all health care decisions. That is in large part because Democrats have been working for years to move Americans from the small group market to the Obamacare exchanges, even though, according to Congressional Budget Office estimates, Obamacare plans per enrollee are 3 times more expensive for taxpayers than employer-sponsored insurance. In fact, in a reported article in Forbes, December 22nd, 2013, the Obama administration provided special carve-outs for labor unions when they realized the increased cost of provisions like the reinsurance tax. So how is HHS working to help remove barriers of access to employer-sponsored markets for Americans?
Congressman, we work closely with all those stakeholders in the insurance market for health care. We try to complement what's being done by employer health insurance providers. If, for example, on Medicaid redetermination, as some individuals who are currently on Medicaid in your state may end up losing coverage through Medicaid, we work with employer-sponsored insurance companies. Why
wouldn't you give waivers to employee-sponsored plans so that they can go out into the private markets without the assistance of the government? In other words, have a system where we can actually compare costs in the private sector versus this government-run system.
Well, Congressman, remember
why wouldn't you give those waivers? Yes or no?
The marketplace plans that people receive under Obamacare are private sector plans. They are not government-run plans.
No, sir. That's not correct. The private insurers have to, they have to abide by, the providers have to abide by all of the requirements in Obamacare.
Well, of course, you want to have minimum standards.
It's not a private plan.
You do want to have minimum standards.
Do you believe Americans from government-sponsored plans under Obamacare to the private employee-sponsored market would be beneficial? Do you believe we could save money in the federal government if we allowed these folks to go totally private?
We would
these
love
association plans.
We would love to continue to work with anyone who can come up with a lower cost prescription drug plan or any kind of plan for health care overall.
Well, I guarantee you, if you will give them the waivers, they will do it. Mr. Secretary, prescription drug middlemen like pharmacy benefit managers are raking in profits while evading congressional scrutiny. An executive for one of the big PBMs recently told investors to not worry about Congress, that it would find ways to maintain its level of profit if those reforms to things like drug rebates went into effect. Earlier this Congress, I joined my colleague from Georgia, Buddy Carter, who is a pharmacist, in introducing the Drug Price Transparency and Medicaid Act to establish oversight and accountability for PBMs taking part in spread price practices in Medicaid programs that often leads to low reimbursement rates for pharmacies and artificially raises health care costs. What other actions can Congress take to increase oversight and accountability on PBMs?
Congressman, great question, because we know the PBMs should get more scrutiny. We hope that you will engage with your colleagues to change some of the statutory rules, because we think we need to get more transparency in that system. I would agree with you. The PBMs are raking in more money than they should.
Thank you very much. Mr. Secretary, as you're aware, this nation was founded on religious freedom when it was adopted as the First Amendment to the Constitution. That's why the Centers for Medicare and Medicaid Services Framework for Health Equity declares each person CMS serves should receive care that is responsive to their cultural health benefits and practice traditions and other communication needs. In light of that, why did CMS reject an appeal from St. Francis Hospital in Oklahoma, which was threatened with termination from Medicare for having a lit candle behind 2 layers of glass in the hospital chapel?
Congressman, I'm not familiar with that case. I could try to get back to you
if you'll get back with me on that.
I will.
And how did this threat ensure Medicare beneficiaries are receiving care that is responsive to them?
Congressman, I can try to get back to you, but I would tell you that we do everything we can to protect religious conscience. We have rights in this country. We want to make sure no one is discriminated against. And so if someone believes that they are being discriminated against because of their religious beliefs, we would want to know that, because we would try to protect those rights.
That's interesting, because CMS finally agreed to a compromise, which incidentally coincided with the story hitting the media. So, like, you might better abide by the Constitution before you put out these rules or deny reimbursement. Thank you, and I yield back.
Thank you, Mr. Allen. Ms. Bonamici, you're recognized for 5 minutes.
Thank you. Secretary Becerra, welcome to the committee, and thank you for your leadership. It's been nearly a year since extremist justices on the Supreme Court overturned 50 years of precedent that protected reproductive health care in this country. And since then, we've seen the devastating and really wide-ranging effects of this decision, especially on the approximately 22 million people of reproductive age who now live in states where abortion access is restricted or banned, and it also affects their families as well. So many have made harrowing journeys to another state to receive needed medical care. I just heard about a young woman who was experiencing an ectopic pregnancy, which, as you know, can be life-threatening if not treated. She was denied care because of the state law. She had to travel to another state. I'm sure this is not the only case like that. I've heard from doctors, some doctors have had to watch their patients' health deteriorate significantly before providing care because of life of the mother exceptions, putting those doctors at risk. Stories of people being turned away, the sort of leave until you're closer to death approach, which is incredibly dangerous and concerning. So even before the Dobbs decision, maternal death rates in 2020 were 62% higher in states that ban or restrict abortion than in states where abortion is accessible. So with the kind of restrictions that many of these Republican-controlled states are imposing, do you expect maternal mortality rates to increase or decrease in this country?
Congresswoman, the signs are pretty clear that we would expect to see mortality increase as a result of what is now in place under the Dobbs decision.
Well, that's very concerning. My Republican colleagues like to call themselves pro-life. Mr. Secretary, does enacting laws that increase maternal mortality rates sound pro-life to you?
All I can tell you, Congresswoman, is that pregnant women in states with abortion bans are nearly 3 times more likely to die during the process of bringing a child into their family.
Well, we have some work to do, and I thank you for your leadership on this issue. I want to talk about child care. Your budget reflects that you understand, and the administration understands, fortunately, the importance of child care for families, children, for the economy. As you noted in your testimony, we get a return of up to $9 for every dollar we spend on early childhood education. So I fought hard for the nearly $40 billion in child care stabilization grants that help providers keep their doors open during the pandemic. But providers across the country are now facing this sort of fiscal cliff when the American Rescue Plan stabilization grants end. So how can we work together to prevent a wave of child care provider closures in September? And if the budget request we're discussing today is fully funded, which I submit should happen, will that fully close the child care gap, or will there still be child care deserts? And then also, in response to that, will you talk a little bit about the workforce? There's a tremendous need, as you know, to grow the workforce, and I know you have a workforce center designed to attract the approximately 100,000 child care workers lost during the pandemic. So what more can we do to meet these workforce needs in care?
Congresswoman, the President's budget outlines a great proposal to try to move us forward on child care. We know that we don't have a large enough workforce. We're never going to get it to be where we need to be, so long as you can go flip burgers at a hamburger shop and probably make more money than caring for our children in child care programs. We need to try to expand services. The president's budget proposal actually works with states to expand access to child care services. And of course, you know that the president's been trying to get through a robust proposal for child care programs and Head Start. And we look forward to support there.
It's such a good investment in our children. I'm going to go back to reproductive health care because I've been concerned for years, since my time at the state legislature, about so-called crisis pregnancy centers. Many of these centers regularly provide inaccurate, incomplete, and injurious information to people who are seeking guidance and actually fact-based reproductive health care. So I recently reintroduced my Stop Anti-Abortion Disinformation Act to direct the Federal Trade Commission to prohibit unfair or deceptive advertising of abortion services. So what dangers do crisis pregnancy centers pose for patients, and what is the department doing to help regulate the spread of reproductive health misinformation?
Congresswoman, every American deserves to get accurate, complete information about health care, because when you make very important health care decisions, you need to make sure that you're making the right decision. And so we are going to do everything we can to make sure that if you are out there providing services, that you give to every American the information that they are entitled to when it comes to the services that they're about to take.
Accurate health care information is what's needed. Well, I'm proud to be from a state that respects the right of people to make their own reproductive health care decisions. And thank you for visiting Oregon, where we talked about the 988 service that's being provided out there, especially for our youth. It was a great visit, and I appreciate that. And I yield back my time. Thank you, Madam Chair.
Thank you, Ms. Bonamici. Mr. Banks, you're recognized for 5 minutes.
Mr. Secretary, when you were the Attorney General in California, your state expanded its ban on 18 to 20-year-olds owning handguns, including rifles and shotguns as well. And I'm just curious, why do you think that 18 to 20-year-olds can't be trusted with a firearm?
Congressman, let me try to take you back a little bit when I was Attorney General in California, but first by saying, for us here at HHS, gun violence is a healthcare crisis in this country, and we have to do everything we can. I'm proud that my state has tried to undertake measures that would try to keep individuals from using, especially assault weapons, for purposes that never should be deployed in a civilian society. And so,
but you supported these policy changes. I'm just curious, what was it about 18 to 20-year-olds that you focused on to take away their gun rights to own rifles or hunting shotguns and other firearms? What was it about that age, 18 to 20-year-old?
Yeah, we could go back to the legislative record. I was not the legislator, a legislator who voted for that legislation, but I was the AG who defended our state's laws.
You didn't believe that an 18-year-old should be allowed to own a hunting rifle. Is that? I mean, that's what you supported then. You still believe that today?
My job as the Attorney General was to defend the laws that the state of California has
enacted. So you do think that an 18-year-old should be allowed to own a hunting rifle?
Congressman, when you are the Attorney General, you have an obligation to support and defend the laws of your state. I happen to believe in many of those laws that help us not only protect Americans from gun violence, but also keep weapons of destruction out of the hands of Americans when it's not necessary.
Okay, interesting way to dodge the question. I mean, back then you clearly defended and supported changes in the law to stop 18 to 20-year-olds from being able to own a firearm. And I just want to ask this question. Why do you think that children much younger than 18 years old, 9, 10, 11-year-olds are mature enough to make a decision to have a sex reassignment surgery?
And
because you support those policies too. So can you defend that for the committee? Why do you believe that a 9, 10, or 11-year-old should be allowed to change their sex?
So let me be clear. My position, my views have not changed with regard to gun violence and what we should do to try to control that mass killing that's occurring. And so whatever my views were when I was Attorney General on those issues are still probably the views that I have now. Again, I'm not the Attorney General of California anymore. With regard to the health care of any individual...
Let me just be really clear. Then you believe that an 18-year-old shouldn't be allowed to own a hunting rifle. Today you believe that a 9, 10, or 11-year-old should be able to change their sex and have an irreversible surgery to do that. Just help us explain the the logic.
Yeah, Congressman, I would appreciate you if you let me characterize what I believe, and we can have a good conversation rather than you characterize what I believe. And what I would say to you is, with regard to gun violence, I think it is important that we take actions to protect our communities and our neighborhoods. With regard to
I don't think you
issue-
want to explain it because you realize how crazy it is, and that's why you're
No, that's
dodging
not
the
the
question.
case.
Let me move on.
No, that's not the case.
This spring, HHS released a 112-page report claiming that gender affirmation, including social transition, changing one's name, pronoun, and/or appearance, is appropriate and beneficial for gender minority children and adolescents, according to this report. The report recommends cutting federal funds from states with, quote, policies that stigmatize transgender children, including by denying them access to medically necessary health care, end quote. Mr. Secretary, does this mean that HHS is seriously threatening to withhold hospital grants from states like my own if they refuse to go along with surgeries or puberty blockers for kids?
Congressman, we're going to protect the rights of any American to get the health care they're entitled to. And if someone tries to stop them from that, that's a violation of the law.
So you would withhold hospital grants from states like mine that ban transgender sex reassignment surgeries for minors? I mean, that's what the report says, clearly.
We will protect the rights of any individual to receive the health care they're entitled to, and we will take action against anyone who tries to discriminate
So
against a person.
that's a yes. And I want to ask you the same question that I asked Secretary Cardona the other week. Do you support pulling federal funds, federal school lunch benefits from schools that refuse to comply with your definition of gender identity? Withholding school lunches from kids in schools that won't recognize the definitions that you do.
Congressman, I would not hold anyone to the standard of having to uphold my definitions. I would hold them to a standard that protects what the rights of
It's
Americans
pretty clear
are
what you
under the
believe.
law.
The report says so, Madam Chair. I hope and pray one day that the history books look back and realize just how crazy the policies of this administration are. And Mr. Secretary, your photo with the president is going to be in those history books, as history will not look back fondly on your policies. I yield back.
Thank you. Mr. Chicano, you're recognized for 5 minutes.
Thank you, Madam Chair. Mr. Secretary, it's my colleagues on the other side of the aisle want to create some sort of moral panic over gender-affirming surgeries. I've heard from the transgender community that I don't know of any that surgeries be for minor children are hardly ever, if ever, performed in this country. Is that your understanding of the current state of affairs?
I'm sorry, ask the question again, Congressman.
My question is gender-affirming surgeries for minor children, those below 18 years old, are hardly ever, if ever, performed in our country.
That's right. It's very rare, and it's always done through the consultation with the medical expert.
It's extremely rare, and so this moral panic being created by this line of questioning, I think, is meant to inflame Americans' sensibilities about transgender people and stigmatize them. That's my sense of it. I want to turn to your role, Mr. Secretary, as you have responsibility over the Office of Refugee Resettlement and the Administration for Children and Families, correct?
Correct.
And the responsibility of vetting sponsors to host unaccompanied minors falls within ORR, that's right?
To have custody, temporary custody, yes.
And temporary custody.
Yes.
And when you took office in March of 2021, there was a surge of unaccompanied minors presenting themselves in the United States, is that right?
That's correct.
And it was a significant surge above what had been occurring the year prior.
Yes.
I imagine your concern was to keep these children safe. Is that correct?
That's the primary concern.
And the previous administration was criticized, rightfully so, for keeping children locked up in cages. And was it your intention to avoid this scenario repeating itself?
Well, absolutely.
And I imagine you were looking to respond to the situation differently than was handled by the administration before. I'm looking at a recent audit conducted by your department, which revealed that the Office of ORR adhered to its program policies and procedures designed to meet or exceed statutory requirements in the placement of unaccompanied children with a vetted sponsor. Mr. Secretary, do you believe that the current statutory requirements provide you with enough authority to protect our unaccompanied minors effectively?
Congressman, the authority is sufficient for the work of protecting these children while they are in our custody. The moment we are able to place them with a vetted sponsor, we lose custody. What happens after that? Well, we've seen some of these reports, New York Times and others, that show in some cases some of these kids have been exploited by employers and companies. And that's where I think we have to really focus. We don't have that jurisdiction. Not even the Department of Labor has sufficient jurisdiction. But if we want to have a better sight of what's going on with kids after they leave our care, I would urge Congress to consider that.
Thank you. And so you see a room for whether giving you more authority, labor more authority, or some entity more authority. Would you say that our current federal statutory environment, whether regard to the Department of Labor or your department, or how you relate to state and local agencies, that there are definitely holes of authority, and kids are falling, these unaccompanied minors are falling through the gaps in terms of protection?
Without a doubt, I suspect that the Department of Labor has come and testified how they lack the number of inspectors they need to do the oversight of violators of child labor laws, employers and companies. And certainly there is a gap when it comes to how we protect children, make sure they're going to school versus going to the workplace. Those are the kinds of authorities that we do not have existing right now.
So you don't have the authority, nor say the funding or the staffing, to do case management after you have placed these children, because that's you have temporary custody. You've handed the custody over to these vetted sponsors. But as far as monitoring what goes on with those families, monitoring whether or not they're adhering to sending those kids to school as required by law, you don't have the resources or authority to do all that, do you?
You hit the nail on the money, because what you've pointed out is that unlike foster care in America, where a foster child may go to a home, but the foster care agency still has custody over that child, we do not maintain custody once that child is placed with a vetted sponsor.
And you don't have any, and there are no resources going to that host family, like in a foster family. They're given some money to take care of that kid.
That's correct.
So there's no ability for you to do case management post.
The link is not there.
Thank you. I yield back, Mr. Chairman.
Thank you, Mr. Takano. Mr. Comer, you're recognized for 5 minutes.
Thank you, Madam Chair. Mr. Secretary, thank you for being here today. During your testimony before the Senate Appropriations Committee on the Department's fiscal year 2024 budget request, you were asked about the role of pharmacy benefit managers they play in rising drug costs. I know those questions have been addressed earlier, but this is something that the House Oversight Committee is taking a lead on and investigating. You responded, and I quote, "I think we know that there are some folks who are very clever and creative in how they do this work. Middlemen have always skimmed money off the top, and it's a matter of how we can try to keep the resources where they're most needed, with consumers, not with the middlemen." End quote. Now, we've recently seen this idea stated directly from the Chief Financial Officer of CVS Caremark, Aetna, who was quoted on May 31st at an industry conference when asked about the potential reforms proposed in Congress, as saying, and I quote, "There's other ways in the economic model that we can adjust if one of those things changes," end quote, and he advises his peers not to worry about Congress. Now, this blatant admission by PBMs of behind-the-scenes control of cost of patients and pharmacies allude to the factors and evidence that have led the House Oversight Committee to examine how these middlemen weaponize their access to patient information at the expense of those they were intended to benefit. So today, every major PBM is owned by a major health insurer and owns or is owned by a specialty mail order or retail pharmacy, or all three. So, Mr. Secretary, PBMs were found to have overcharged state Medicaid programs millions of dollars by claiming they paid competing pharmacies higher reimbursements than they actually did. Kentucky, my home state, for example, was overcharged $123.5 million. Are you familiar with these instances?
I'm familiar with the general proposition that you're stating, yes.
So would you say that PBMs engage in self-serving practices at the expense of patients and taxpayers?
Clearly something's going on where consumers are not benefiting the way they should, and many providers are paying more than they should.
Do you believe this is evidence of vertical and horizontal manipulation of the pharmaceutical market?
Mr. Chairman, you're going to where I used to be when I was Attorney General in California, but I will tell you that we need to look closely at these programs because PBMs should not be able to game the system.
And I agree. My criticism of the whole PBM saga is that Congress has been looking at it for a long time. And it's well past time for Congress to do something.
I agree.
And we want, the question I have for you, is there anything as Secretary you would advise Congress to do to cut out this unnecessary middleman that's costing consumers and it's costing Medicare and Medicaid a fortune?
Yeah, Congressman, transparency. As they say, sunshine is the best disinfectant. We need to go behind the curtain to see what they're doing. No one is saying that we don't need someone who can make sure that from the pharmaceutical company to the consumer, the medicine gets to them. It's just how it's getting there. Are these middlemen taking advantage? And so we need to be able to get behind the curtain. So whatever you can do to help us have the transparency.
Well, let me ask you this, Mr. Secretary. Would you be supportive of reforms or limitations to the pharmacy benefit manager model, including preventing PBMs from owning the pharmacies, insurers, and clinics for which they are expected to negotiate?
Yeah. Very interested in exploring all those ideas with you because we do need to make some progress and we do need Congress to act.
If you keep up with much that the House Oversight Committee, which I'm honored to serve with our distinguished chairwoman, Ms. Fox, very, very active member on the House Oversight Committee, we don't agree on a lot in that committee. When I say we, the Republicans and Democrats. But there is 100% agreement and 100% bipartisan support to act on these PBMs and do more than requiring them to be transparent. That's a political talking point. That doesn't do anything. One of the suggestions, and there are bills, I know you mentioned a couple of the bills in energy and commerce, but I think there's support on that oversight committee, bipartisan support. I know Representative Porter, Representative Ocasio-Cortez, Raj Krishnamurti. There are many Democrats that agree with my school of thought that we should break these PBMs up because you cannot be vertically integrated. I mean, what the PBMs were created to do, and by all accounts, there needs to be someone negotiating these drug prices. What they were created to do and what they are doing is they have gone so far off the reservation. I'm a Republican, I'm all about making money, but this is ridiculous what they're doing. This is costing consumers and taxpayers. So if we're going to have a serious conversation about reducing drug costs in America, and we don't mention the PBMs, then no one serious about reducing drug costs. We have to do it with the PBMs, and we have to do more than require transparency.
Our team's ready to work with you, Mr. Chairman.
Thank you, Mr. Comer.
Sure. Yield back.
Dr. Adams, you're recognized for 5 minutes.
Thank you, Madam Chair, and thank you, Secretary Becerra, for coming to the committee. And it's good to see you again, and I appreciate you coming into my district and all the great things that you're doing. Thank you for your leadership. I have to agree with Mr. Courtney, who talked about the $35, and I agree that certainly you shouldn't have to be old, as I am, or some of the others, to get that benefit. But because we have young children who also have diabetes and so forth. But anyway, thank you for doing that. There have been a series of reports, and I think one was referred to earlier in terms of and I will just say there was a video that was leaked, and as a result of talking about the children and migrant children and processing them. And I want to just give you an opportunity to speak to that. But you have also, HHS, announced some initiatives to address some of those problems. And if you could just speak to a couple of those, I'd appreciate that.
Congresswoman, thank you very much. And I look forward to a visit again when it's accommodating for you. Our foremost priority is the health and safety of these children while they are temporarily in our custody. We have then an obligation to find a more appropriate setting for them while they're awaiting their immigration proceedings to conclude. And so rather than stay in a federal congregate care setting with a lot of other kids where they're not getting that more individualized care, we seek to find sponsors who will protect them, who will take care of them. Typically that means a parent or a very close relative for most of these children. And so we go through the process of providing them while they are temporarily in our custody with health care, medical checks, mental health services, in some cases educational services. We try to provide everything that a licensed care facility for someone, for example, who's a foster youth might get. We do it temporarily. Typically a child will stay with us from 3 weeks to 4 or 5 weeks. Some stay longer, some stay less. And what we try to do is make sure we work efficiently, because some of these kids have come with a lot of trauma. And so it's all the medical experts, all the child welfare experts will tell you, all the migrant children advocates will tell you, it's best to try to get that child with someone that child knows and loves and is a close family relative. That's our goal. It's tough because in 2021 we had large numbers of these kids. Today it's much more manageable, but we continue to try to make improvements as we go along.
Thank you. So let me ask you a question about the whistleblowers issue, and that's been in the news a lot, and retaliation against whistleblowers. There was an article in the New York Times that you were aware that staff in the agency were raising concerns about the safety of unaccompanied migrant children who are being placed with unrelated adults. And to the best of your knowledge, did the department demote, transfer, or terminate staff because they raised concerns about the safety of children in the care of the Office of Refugee Resettlement?
Absolutely not. OR did not demote anyone because they raised concerns. In fact, we encourage our OR staff, our Office of Refugee Resettlement staff, to report, and we urge the contractors that we work with to provide care to report. In fact, they are obligated to report any instance of abuse of a child.
Okay, let me ask you, I've been very involved with the issue around domestic violence, and I know that you have been concerned about this issue as well. So could you just speak to the importance of reauthorization and how delaying the reauthorization of the, when the House passed the Family Violence Prevention and Services Improvement Act, can you speak to how delaying the reauthorization would hinder the efforts to prevent intimate partner violence and support of victims?
Congressman, first, let me just say, I hope you and your colleagues have success in getting us to reauthorize the Family Violence Protection and Services Act, because it is indispensable. We know, for example, that during COVID, when people were in their homes and afraid to come out, that there was a rise of domestic violence. We know that Americans are being injured, in some cases killed, because we're not there to provide the services, whether it is the victim who needs the services or the perpetrator who might need the services. And so we're hopeful that we can continue to make the investments that let us reach people before the violence occurs. Because most of the time, as you know, it's violence between people who know each other very well.
Right, proactivity is what we need. Thank you very much, Mr. Secretary. Madam Chair.
Thank you, Dr. Adams. Mr. Good, you're recognized for 5 minutes.
Thank you, Madam Chairman. Thank you, Mr. Secretary, for being with us once again. There's a story that just came out today that OpenTheBooks.com, as you know, watchdog group who tracks government's reports, of payment reports, I should say, and is reporting that the federal government made nearly $3 trillion in improper payments over the last 20 years, but we reached a record level last year with about $250 billion in bogus payments. And it cited HHS as being number one. I guess it's great to be first or number one in something maybe, but HHS was the worst agency of all, and it reported that Medicaid had about $80 billion in improper payments, and Medicare had about $46 billion, so combined together it was right at $127 billion. Can you just share some thoughts on that?
I've not seen those reports, but I will tell you that we know that there are people who are always trying to game the system. Medicaid and Medicare, some of the largest programs in the country, certainly are ripe for that. That's why our budget calls for more money for program integrity, so we can go after those fraudsters. We know that for every dollar.
So why would we give more money to manage something when we've got $127 billion in bogus payments last year? Why would the answer be to spend more money?
Well, the Inspector General, our oversight and law enforcement agencies would need to do oversight in order to recoup some of that money from fraudsters.
So $127 billion in improper payments, and your solution is to spend more money. Let me ask about the border. Let me ask about the border.
It's to make sure
we do the
oversight. Let me ask about the border,
so I reclaim my time. Do you think the United States has operational control of the border?
No, so you're asking me a question that's outside of HHS's
Do
jurisdiction.
you believe the United States has operational control of the border?
I think the U.S. government has done yeoman's work in trying to make sure that we can protect Americans.
Do you think that the United States has operational control of the border?
I think the federal government is proving that we can manage the border.
What would a loss of operational control of the border look like?
I'm sorry?
What would a loss of operational control of the border look like? How would you define a loss of control if this is control?
So if we're leaning to something relating to the jurisdiction of my department, HHS, I'm more than willing to try to answer. Otherwise, I think you're more appropriately...
Well, HHS is more involved with the border than they've ever have been under this administration. So what would a loss of operational control of the border look like if this is control of the border?
Again, Congressman, I could talk to you about my personal views, but if you wish to know what the federal government should be doing with regard to the border, I would urge you to continue to ask questions of the Department of Homeland Security.
The ORR, or Office of Refugee Resettlement, has lost contact with more than 85,000 migrant children last 2 years.
That's not true, sir. That's not true.
Well, what is the accurate status?
We've not lost contact with kids. Well, once we place those children, we lose jurisdiction over those kids. And so we can't lose people we don't have jurisdiction over.
Well, so what percentage of the 85,000 would you say that your department has followed up with in the last 2 years?
We try to follow up with every child that we place in the custody of a vetted sponsor. Whether the child or the sponsor choose to reply or respond to our efforts to reach them is another matter, because Congress did not give us the authority to make them respond to us. So we reach out to every child. We try to contact the child. We try to contact the sponsor. It's no guarantee that we're going to get that child or sponsor to respond to our overtures.
There's reports that migrant children have been found working in slaughterhouses, operating machinery, doing other hard labor jobs. Yes. Do you believe your department's adequately screening UACs?
I don't believe that these children are receiving the oversight protections when an employer or a company is violating their labor rights. But we don't have jurisdiction to try to enforce against violations of child labor laws. That's not within our jurisdiction. Even the Department of Labor would tell you they don't have enough resources and personnel to go out there and inspect all these work sites the way they should.
In a recent oversight committee hearing, the ORR director admitted that only a third, or 37%, of UACs ended up with a parent. Do you agree with that assessment?
I think that number is pretty accurate, that about a third of the kids that we place are placed directly with the parent. And if those kids aren't placed with the parent, the chances are they're being placed with a close relative of that child.
Biden plans to rescind the Trump rule exempting individuals and entities from the contraception mandate on moral convictions. Given that the District Court for District of Columbia decision in March for Life versus Burrell, how does your department's proposed rescission not violate the Constitution and religious liberties?
I'm sorry, can you state the question again?
I'm out of time. I'll yield back, Chairman.
Oh.
The gentleman can submit his question, and we can ask a response in writing from the Secretary. Ms. McBath, you're recognized for 5 minutes.
Your microphone is down.
Thank you, Secretary Becerra and Chairwoman Fox, Ranking Member Scott, and to all the staff that are put together today's hearing. I'm a 2-time breast cancer survivor and the daughter of 2 healthcare professionals. So healthcare is very, very personal to me. And I'm so excited to finally see a budget that truly puts working families and their healthcare needs first. And as I said, I'm a 2-time breast cancer survivor, and I have personally benefited from the protection afforded by the Affordable Care Act. Because of the ACA and the work of the congressional Democrats, folks with pre-existing conditions like me won't be denied coverage simply because we are more likely to have to use that coverage for our health care needs. When going through physically draining treatments like surgeries, radiation, and chemotherapy, and they are very, very draining, Americans and their families should be able to focus on getting better and rebuilding their lives, not on trying to avoid having to declare bankruptcy because of an unpaid medical bill, which is the #1 cause of personal bankruptcies that have been filed in this country. I often hear my Republican colleagues discussing the high cost of health care after the passage of the ACA, but they consistently fail to recognize how much higher the financial and health-related costs would be for working families without these critical protections and programs. Sadly, the proposals that have been put forth by my Republican colleagues will do nothing to lower the prices or increase access to this care. And the percentage of Americans without health insurance is down to the lowest level in our nation's history. And Medicare can finally negotiate directly with drug companies to ensure that American seniors aren't paying more than they need to pay for their prescriptions. And the fact of the matter is that the price of insulin would already be limited to $35 a month for working families on private insurance as well as Medicare if my Republican colleagues had not intentionally gone out of their way to block this from being signed into law. And because of President Biden, congressional Democrats, and your really important work at HHS, out-of-pocket insulin costs for people on Medicare are now capped at $35 per month. And many private drug companies are following suit and taking action to lower their costs of insulin, of the drugs that they sell. But we know Congress definitely has to do more. That's not enough. But I'm very proud to be a co-lead of the Affordable Insulin Now Act, which ensures that no American ever pays more than $35 out of their pocket per month for the life-saving insulin drug. And lowering the cost of insulin for Medicare beneficiaries is phenomenal. It's a phenomenal victory in the fight to make health care and prescription drugs far more affordable for working families. But as Americans with diabetes below the age of 65 know full well, this simply isn't enough. It doesn't go far enough. The budget put forward by you and the President would ensure that Americans in group and also individual market plans also have access to these life-saving drugs at prices that they can afford and that their families can afford. Secretary Becerra, can you talk about who the additional folks are that would be helped by this expansion and why it's so vitally important that we get this done for the American people?
Congresswoman, everything you said I agree with, and I applaud you for your courage in fighting past the cancer that you've had. And we should give everyone that opportunity the way you have just marshaled through that. And if we were to expand care, we would find that more Americans would stay healthier longer, live better lives, and be able to rest, have peace of mind. And so the expansion of health care gives everyone the chance to really pursue what they are best at. But if you have to worry whether or not you'll have insurance if you try to change jobs, or if you worry if you'll be able to get the care you need for cancer if you change jobs, those are the kinds of things that really panic Americans. And so expanding healthcare so that not just those on Medicare, for example, get $35 a month insulin, but every American gets that is crucial, because you want to know that you're saving some money. And you can do other things, even if it's something as basic as giving your grandchild a birthday gift now that you can afford it.
Well, thank you so very much. We really appreciate all the work that you've done, and keep up the good work.
Thank you.
Thank you, Ms. McBath. Ms. McLean, you're recognized for 5 minutes.
Thank you, Madam Chair, and thank you for being here. I know there's been a lot of talk today about the unaccompanied minors and the children and whatnot, so I want to try and clarify it and just get some simple answers. You vet the sponsors who you place the unaccompanied minors with, right?
That's correct.
Okay. How many total unaccompanied minor children do you think you deal with every year?
Every year. I believe, and I can try to get you the accurate numbers, but I believe in 2021 it was something over 120,000 children.
Okay,
Yeah.
roughly 120-ish,
Yeah.
give or take.
In
Okay.
2022, close to that as well.
And I've heard, I know the New York Times obtained data from your office and your department saying that your agency had failed to reach more than 85,000 unaccompanied minors. Is that inaccurate?
Completely inaccurate.
Okay. Do you know who they contacted from your office? So this is just a bogus story that the Times put out?
No, it's that they use statistics in the wrong way. Because we
Okay.
try to track children, and we, as I mentioned in a previous exchange, we reach out to these children, to the children and to the sponsors.
And if they don't respond, they get checked as they haven't responded?
That
Okay.
we make note all the
So
time.
how many unaccompanied minor children are actually unaccounted for?
Are what?
Are unaccounted for? So if let me give you an answer. So, example. We vet
Yeah.
and place 120,000,
Correct.
give or take-ish, right? Of those, how many are not accounted for? How many of those people don't respond?
So when you say accounted for, are you saying how many do we try to check on their status?
I'm going to say you try and check all of them,
Correct.
right? Okay.
Correct.
How many of those people don't respond and we aren't able to track?
The vast majority, I think it's over 80%, we have been able to reach either the child or the sponsor, and we make an effort 3 times for each child.
Okay, so roughly 20%
Did not
we
respond.
are unaccounted for.
Not unaccounted for because they are with their sponsor likely.
Well, how do you know they're with their sponsor if you haven't been able to contact the child or you haven't been able to contact the sponsor?
Because when we place them, they are with the sponsor. Now,
Okay,
what
but I place you today, but you may not, if you don't respond, right, the sponsor doesn't respond, or the child doesn't respond, how do you still know that they're with the sponsor?
Well, HHS doesn't have the jurisdiction to try to follow those children. And so when you say they're unaccounted for, you're implying that we should be able to account for them. Once they are placed.
But you are.
I'm sorry?
But you are. So my point is, let's just say you place 120.
Correct.
Right? There's a whole batch of unaccounted children that we don't know. We don't know if they're being trafficked, right? Because we know human trafficking is a problem. We don't know if they're in child labor, right? In my state of Michigan, we had this issue with child labor. We don't know what's happening to these children. We're making some pretty broad assumptions. That's all I'm saying. Are you disputing that fact?
No.
Okay.
No.
All right.
But could I clarify?
Sure.
This is not like a foster care program where
No,
the
it's
agency.
worse. I would agree.
In many respects, you're right, because
it's
there is
worse.
no connection. And
Right. Right.
saying they're unaccounted implies that there is a way to account for them, and Congress never
Well, there
gave
is a
us
way. There is a way,
How?
because you just told me that you are accountable
No,
for, well.
but I can't account for them because I don't have jurisdiction. I don't have jurisdiction
Then
to
why are
require-
you tracking them anyways? If you have if you
Because we
don't
think-
have any jurisdiction, you shouldn't be following them anyways. Is that what you're telling me?
Congresswoman, because we believe it's
that what you're telling
important. We believe it's
So you
important.
do have jurisdiction.
No,
Then why are you doing it?
because we believe it's in the best interest of the child.
And I believe it's in the best interest of the child. So would you agree with me that there's 20% of the children that are just twisting in the wind that we're
No.
making a bunch of assumptions on?
Absolutely not.
But because I think it's very convenient that you say, oh, but we care so much about the kids, the ones we account for, the ones that we
No.
can't account
We
for.
reach-
Yeah,
we
that's
reach-
really not my, that's not my
Congresswoman,
jurisdiction.
remember, we
So
try to reach
let's just
every
use the
child.
same context and go. So are you accountable or not accountable?
Do you if
I'm
you give us
asking
the
you the
authority,
questions.
we don't
Are you
have the
accountable
authority.
or not accountable?
We do
Yes or
not
no?
have the authority from Congress to try to keep account of these children once
So
they
that's
are
not
placed.
your job is to have.
That's not what we're
Your
saying.
job is to vet them.
That's not what we're saying.
And then let them go.
That's why we try to
I don't
reach
think
out
you
to
know
these
what you're
kids.
saying because you use the laws that's convenient for you. If we really truly care about the children, we'd care about it when it's convenient and when it's not convenient. And we'd begin to fix a problem that we know we have as opposed to try and cover our butts. With
And
that,
Congress
I
give
yield
us
back.
the
Thank you.
jurisdiction to try to account
Thank
for
you.
these kids.
Thank you. Thank you, Mr. Secretary. Thank you, Ms. McLean. Mr. DeSaulnier, you're recognized for 5 minutes.
Thank you, Madam Chair. Mr. Secretary, nice to see you, the pride of McClatchy High School. I want to talk to you about kids' mental health. What the Surgeon General has said, what the American Psychology and Psychiatric Association has said, the urgency, and as fellow Californians who are well aware of the benefits of social media and technology, but also the challenges, particularly around young people. Surgeon General said that a third of young girls in this country, American girls, have contemplated suicide. 10% of young people in the United States have attempted suicide. So we know this connection now. The amazing investments we've made in behavioral health, and when you look at Johns Hopkins, UCSF, Stanford, your alma mater. I was just there 2 weeks ago to visit their Center for Youth Mental Health and Social Media. These connections, my own view is the private sector is using what we've learned from neuroscience, particularly in cognitive development, to addict young people. And it goes right to some of the more unpleasant parts of human nature. So can you talk a little bit about what we can do to get on top of this? We're losing a generation, according to the Surgeon General and the professionals, about how young people are spending 3.5 hours a day on social media and media. We know what they're doing. We know with these amazing investments, we probably learned more than in the last 50 years on cognitive development because of imaging and the investments at NIH and NI Behavioral Health on how this is affecting people. But it's frustrating to see what's happening literally every day in this country. What can we do to partner with you? And it should, in my view, and Madam Chair, we've had these discussions, this should be a nonpartisan issue of great urgency, is to putting some guardrails on innovation, quote unquote, to make sure that we're doing no harm to future generations of Americans.
And Congressman, as you know, technology is outpacing our ability to keep up with it. And so once we come up with a way to try to help these children survive and improve their mental health status, something else comes up that's new in social media and so forth. And so it becomes very difficult. We are trying to partner with many of the institutions and agencies that are trying to help kids to try to improve opportunities to get to them before social media takes them on the wrong path. We're, for example, trying to do far more mental health in our schools. And we're encouraging school districts to work with us to see if they can qualify to get Medicaid dollars directly so they can provide behavioral health services at their school sites for kids. And so we'll try to do what we can to expand access to health care. But I will tell you, one of the most important things we can do is finally treat mental health on parity with physical health, because we still have insurers who are not reimbursing for mental health services when they would reimburse for other physical health services. So we have to do more to really put mental health on par with physical health.
I appreciate that. The sense of urgency, that word, I think is imperative. I look forward to working with you. On a different subject, as a survivor of cancer with a form of leukemia that is chronic, but I was just told, again, at your alma mater, I don't spend a lot of time on the peninsula, but I did. It's some of the work they're doing now. They now think, again, because of public investment, that you can cure what historically my form of leukemia is chronic. So I was asked to go speak to the head of UCSF's cancer program, who spent years running London's cancer programs. He talked about the difference in the cultures. He wanted to talk to me in frustration about all the amazing diagnoses and treatments they have, but the disparity that they can't get. He told me with quite a lot of passion, there are people within an hour of this institution that I can save their lives, but they can't access that treatment. What can we do on disparity specifically in cancer? And then secondarily, I just want to mention the drug that keeps me alive in my pocket. When I started taking it was $500 a day. It's now less than $100, but it's still, in Australia, it's a little over $25 a day. And executives, when I ask them, they say that's part of our business model. Americans pay to subsidize lower care. So in the 30 seconds we have left, could you talk a little bit about the disparities?
Just generally, this is what happens when you treat healthcare as a commodity, that you game the price. And it's a matter of whether you can afford the price, not whether you can get the healthcare you need. That's got to change. But also we have to do more to make sure that we're reaching people at the beginning. Cancer screenings went down. Some 9 million Americans missed their health screening during COVID. We need to get back to doing the basics of prevention so we can try to keep people from ever catching cancer.
Thank you, Mr. DeSaulnier. Ms. Miller, you're recognized for 5 minutes.
Thank you. Mr. Secretary, do puberty blockers pose a health risk to children and teenagers?
Congresswoman, if a medical professional has been recommending health care for an individual, then I would believe that that healthcare professional had the best interests of that individual in mind in prescribing or recommending certain treatment or medicines.
What does your own FDA say are the risks of these chemical castration drugs and puberty blockers to young people?
Well, no drug would be on the market if it were not considered safe and effective by the FDA.
Right.
And so therefore,
what does the
those
FDA,
drugs,
what is your own FDA saying the risks are?
well, with any drug, there will be some level of risk.
Yeah,
But
you're
if
not
it's-
answering my question. What does your FDA say the risks are? Because people want to know the risks.
And Congressman, I'm trying to answer you the question. If the Food and Drug Administration has put a drug out for the market for consumers to use, it is because they have found that drug after doing research and looking at the evidence. They have found that drug to be safe and effective for its use.
Well, I'll answer the question. Your own FDA has admitted these puberty blockers cause brain swelling, brain tumors, vision loss, even blindness. Why is the Biden administration and your agency continuing to promote these blockers when you know that they're harmful to children and young adults?
Congresswoman, as I said, you've shown me nothing that says that the FDA didn't go through a process to ensure that a particular drug was safe and effective. It would not be on the market if it weren't. We would find FDA in court for having put a drug out there in the market.
I'd like to enter into the record the FDA's warnings, which I have up here also.
Without objection.
And also in a written answer to me after the last hearing, you wrote that taxpayer dollars should be used to pay for sex reassignment surgeries and chemical castration drugs for children. And so do you still hold that taxpayers should be paying for this?
Congresswoman, maybe you should read what I actually said, because that's not what I said.
Yes. You believe that taxpayers should pay for this, and why are you going around parents and medical professionals and putting out guidance directed toward children and young adults, promoting the use of chemical castration drugs and puberty blockers that cause significant health risks?
Congresswoman, I assure you, I did not say what you just said.
Your own agency, the CDC, has directed toward young people guidance using these dangerous drugs with potential serious life-altering side effects. And also, I'd like to know, did the second dose of the COVID mRNA vaccine cause cause myocarditis in young people and teenage boys, young adult men and teenage boys?
Congressman, again, those drugs that the FDA found safe and effective have helped save millions of lives, and today we're able to go about our business in a far safer way, even though COVID is still with us.
Well, how did the risk of myocarditis and health complications from the second dose of the mRNA vaccine compared to the risk of serious complications from COVID in young men and teenage boys? How did that compare?
The fact that the FDA and the CDC have recommended the vaccine shows that the evidence is there to make it clear to Americans that it is safer to use the vaccine and
your
protect yourself
agency, the
against
CDC,
COVID
has
than
put
the
this
risks of
out.
other types
I'd like
of
everybody
health,
to notice the
effects.
alarming red line. That is the increase in myocarditis among young men and teenage boys after they received the COVID vaccine. And I'd like to know why the Biden administration continues to push this on our young men and teenage boys, and even pregnant women and babies to receive this vaccine, but especially our young men and teenage boys who we can see are at increased risk for myocarditis. And I'd just like to say that you don't follow the science, you ignore medical evidence, and you're pushing a political narrative and agenda by pushing puberty blockers and chemical castration on children and pushing a second dose of the COVID mRNA vaccine on young boys when you knew it was causing myocarditis? Thank you, and I yield back.
Thank you. Ms. Hayes, you're recognized for 5 minutes.
Thank you. Wow, we are hitting all the points this morning. I guess I got to tighten up my chart game. I will also just say what I'm hearing, just completely separate from the questions I'm going to ask, is some opportunities for bipartisan support. And when it comes to unaccompanied migrant children, Congress is actually the body that makes the laws and has the ability to give HHS the jurisdiction and the funding and resources to do exactly what I'm hearing so many of my colleagues say is critically important to them. So I welcome a partnership with anyone on the other side to do just that, to make sure that these kids are safe and not twisting in the wind, as we've heard this morning. So I'm here, 2458 Rayburn. But moving on to my questions, which seem even more relevant today, I want to talk to you a little bit about black maternal mortality. We just heard this week that Olympic track and field champion Tori Bowie died from childbirth complications in this country. I was never more aware of the risks to black women in their maternal health as I am now that I am in Congress. American moms are dying at the highest rate in the developed world, with black moms experiencing pregnancy-related deaths 3 times higher than white women. Long-standing variations in access to quality health care, underlying chronic conditions, structural racism, and implicit bias contribute to these extreme disparities. According to the CDC, social determinants of health prevent many minority groups from having fair economic, physical, and emotional health opportunities. To close these long-standing disparities, I recently led the Social Determinants for Moms Act, included in the Black Maternal Health Momnibus Act, which was introduced by Representatives Underwood and Adams. The Social Determinants for Moms Act establishes a whole-of-government task force to develop comprehensive strategies to eliminate preventable maternal morbidity and maternal health disparities. President Biden's budget includes $937 million for the maternal and child health block grants, an increase of $122 million from fiscal year 2023 enacted rates. Approximately $145 million will support investments to address disparities in maternal mortality and morbidity, including proposals to address social determinants of maternal health. Secretary Becerra, how does the Department of Health and Human Services plan to invest the $145 million to ensure the most underserved communities are reached? And additionally, would a task force dedicated to eliminating preventable maternal mortality and maternal health disparities be a resource to HHS?
Congresswoman, thank you very much for the question and all the work that you've done on this. We hope that the president's budget can be fulfilled because that would let us reach many communities. We would use some of that money to not wait for folks to come to us, but to go to them where they live. And so, for example, we are planning to continue to expand our access to women who are planning pregnancy through the doula program, so we can make sure that women are receiving care, not just at the point of delivery, but before that, so they're preparing for that delivery and having good health outcomes. So we're going to continue to work with community health centers, with those programs that reach out to do community health service work, to try to make sure we're getting to people early, because someone who's an athlete at a young age of, I think, 32, should not be dying in her home alone because she's pregnant. But that's where we are. And so people are not being reached. We intend to use the resources to reach them.
Thank you. And rightfully, that should not be happening in the United States of America. My next question, 12.5 million children currently are potentially eligible for child care subsidies under federal rules, but only 16% received subsidies in fiscal year 2019. Last Congress, Democrats in the House passed the Build Back Better Act, which included programs for the expansion of high-quality child care. Unfortunately, this failed in the Senate. But we know that we definitely need to update our child care system. What would it mean to expand child care, not only access, but accessibility to American families so that they're able to afford care?
Well, as you just said, we'd be able to get to more than 1 in 7 children who need that child care. We'd be able to expand that dramatically. We'd also be able to increase the wages of those workers that we depend on to care for those kids, because right now, I believe the average wage of a child care worker is a little over $13 an hour. You can flip burgers and make more money. And so we hope that you are able to secure some of the funding. I believe we're calling for some $400 billion in new investments in child care services and Head Start in the President's budget. We hope you can get us there as far as you can.
Thank you. I yield back.
Thank you, Ms. Hayes. Mr. Kiley, you're recognized for 5 minutes.
Good morning, Mr. Secretary. You've been asked about the huge increase in illegal child labor by migrant children. Here's the New York Times story. Headline, as migrant children were put to work, U.S. ignored warnings. Subheadline, the White House and federal agencies were repeatedly alerted to signs of children at risk. The warnings were ignored or missed. Now, you've testified that that these children are being exploited by unscrupulous employers is the term that you've used. And you also mentioned that some of this is outside your jurisdiction, which is fair enough. So maybe as a point of common ground, can we agree that we haven't done enough, or specifically the Department of Labor needs to do more to crack down on these unscrupulous employers? Do you agree with that?
I'm certain that the Department of Labor would tell you that they love more resources to go out and do the oversight and enforcement work to make sure kids are not being abused in
So as it is, they
workplaces.
haven't done enough. You'd agree with that?
I'm sorry?
You'd agree they haven't done enough as it is?
They've done a great deal with the resources they have.
I see. There's been a 70% increase in illegal child labor. Does that mean is there 70% less staff right now at the Department of Labor? I'm trying to understand why this is a resource question.
My suspicion is if you look at their budget to do the oversight and enforcement, it's not grown to meet the needs.
I see. Thank you. Mr. Secretary, did forcing 2-year-olds to wear masks save lives?
Do what now?
Did forcing 2-year-olds to wear masks save lives?
Making sure people wore masks when it was appropriate was essential to make sure that we were able to get out of this pandemic.
Sure, but that wasn't my question. Could you answer the question that I asked?
Which is?
Did forcing 2-year-olds to wear masks save lives?
And who did the forcing?
Well, your department, or the Head Start, which is under your department, had a mask mandate until late last year for 2-year-olds and above, even outdoors. So can you point to any public health benefit of that policy?
Right. We never forced anyone to do anything because we don't have the jurisdiction or authority to do that. What we did was provide guidance on what would be
Mr. Secretary, did Head Start have a mask mandate?
We provide a mask mandate, a requirement for jurisdictions that wish to receive money to provide particular services.
So Head Start did have a mask mandate for kids, yes?
We had a mask mandate for for agencies that wish to get federal dollars.
So that's a
to
yes.
provide
So can you
services.
point to any benefit,
That's not a yes to
any
your
public
question.
health benefit from that policy, whether it was recommended or enforced or forced, of requiring young children to wear masks?
Did families benefit from the policy of using all protection, all precautions to avoid
No, I'm not asking you to
contracting COVID?
rephrase my
Yes.
question as some abstract question that you'd rather answer. I'm asking that you, as the person who's the Secretary of Health and Human Services, right now, can you point to any evidence that there was a public health benefit to forcing young children to wear masks?
Well, the fact that today we are not losing lives the way we lost them when we first got into this pandemic.
And you think that's
is a
because we
clear
forced
sign.
2-year-olds to wear masks?
That's your interpretation. What I'm saying to you is that using good policies that give us the precautions to keep our families from contracting COVID are helping save
I want
lives.
to quote you from an article from NPR in January of 2022. It says, the United States is an outlier in recommending masks from the age of 2 years old. The World Health Organization does not recommend masks for children under age 5, while the European equivalent of the CDC doesn't recommend them for children under age 12. In retrospect, was it a mistake for the United States to defy the international norm on child masking?
The U.S. has been working closely with our international partners, and we have done more than any other country to try
But that's
to help
not what
our-
I asked you.
our
I asked
country-
you, was it
our
a
partner
mistake
countries.
to defy the international norm on the issue of child masking?
We continue to use all the best practices when it comes to making sure people take the precautions.
Is
they
there a
need
reason
to
you're
be
not
safe.
answering my question, Mr. Secretary?
I'm answering the question the best I can because you keep phrasing questions that are already geared to get a particular answer.
Mr. Secretary, a few weeks ago, we had the testimony from your counterpart, the Secretary of Education, who gave false testimony to this committee. He claimed that he did not encourage states to adopt student vaccine mandates. I wanted to ask your own recollection of your own advocacy. Did you encourage or support the adoption of student vaccine mandates by states or school districts?
We have encouraged states to use all the precautions necessary to protect their populations, including students.
Did you, including student vaccine mandates?
All the precautions to help states protect their populations,
right, but specifically,
students.
did you support student vaccine mandates?
We have supported all the policies that show that they help save lives.
Did you support student vaccine mandates, yes or no?
We have supported all policies that help states make sure people's lives are saved.
Mr. Secretary, Madam Chair, I think we had an opening from you asking for the witness to give frank and honest answers, and we're just not getting that today, I'm afraid, and that's very unfortunate.
Congressman,
I yield
if you
back.
pose questions in a way that I could respond to them, I would.
Thank you, Mr. Kiley. Ms. Stevens, you're recognized for 5 minutes.
Thank you, Madam Chair. And just as a point of record and reference, COVID killed 1 million people in this country. And some of us were in Congress. Some of us were taking the calls, like I did on behalf of Michigan, when we didn't have the ventilators and we had a twice impeached president who was laughing at supply chain disruptions. Some of us were here on January 6th when a president twice impeached now was eating popcorn as the Capitol was being attacked. We are here with the Secretary of Health and Human Services, a former member of this body, someone who is dedicated to the health outcomes of this nation. Now, I only wish that the other side of the aisle could care just as much about the things that they are making up as they do about the real problems impacting Americans. My colleague from Connecticut spoke about a maternal mortality crisis in this nation, the highest in the industrial world. Mr. Secretary, we salute the Biden administration for your commitment to expanding access to quality, affordable health care, a very basic thing. You were here when we passed the Affordable Care Act, and we have been expanding on that and trying to improve outcomes for people. In the middle of a health crisis, a Supreme Court overturned Roe v. Wade, adding and doubling to the challenge of women. Some of us have the physical reality of what it is like to get pregnant and to be fighting for the access to care. Not cheering when Roe v. Wade is overturned and now 14 states passing extreme abortion bans with no exceptions for rape, incest, or the life of the mother. Say that again, for the life of the mother, a human being. So Secretary Becerra, what steps has HHS taken to ensure that women continue to have access to comprehensive reproductive health care in the wake of this almost 1 year later horrible ruling from the Supreme Court to overturn Roe v. Wade?
Congresswoman, we are engaged in a number of activities. We take in actions against healthcare providers that have deprived women of the health care they need at the time during their pregnancy. We are making sure we defend the women's access to mifepristone, a abortion medication that has been in use for more than 20 years. We are continuing to work with family planning programs to make sure women get the right information about the care that they're entitled to. We have taken actions to defend any individual whose rights to health care have been discriminated against and violated. And we continue to make every effort to work with our state and local partners to make sure a woman has access to the care she needs wherever she may have to go to get it.
Well, thank you so much for that response. And I know my good colleague, Ms. Manning from the great state of North Carolina, has played a leading role in making sure that women have continued access to mifepristone. And of course, women bear a disproportionate burden of autoimmune disease, thyroid disease, and other gynecological diseases like endometriosis, certainly compared to male counterparts. And I just want to take this moment to continue to implore your office, with the great role that you play at HHS, to continue prioritizing research to improve understanding of the mechanisms, diagnoses, and treatment of diseases that disproportionately impact women. You know, you go on the NIH site and this condition, that condition just isn't researched enough because it's only impacting 50% of the population, except for, of course, for our colleagues on the other side of the aisle who are possessed about reproductive care and stripping it away from women. So thank you for utilizing your role in that regard. Along the theme of equal access to health care for all people, I'd just like to inquire about continued support for disabled Americans, a group of workers whose rights and opportunities are so often stifled in the workplace. Essential laws like Section 504, the IDA work together to protect children and adults with disabilities from exclusion, and unequal treatment in schools, jobs, and the community. So, Secretary Becerra, what can HHS do to strengthen enforcement of civil rights mandates, including Section 504 of the Rehabilitation Act, to ensure that the 64 million people with disabilities in this country have adequate and equal access to health care?
Congressman, thank you for the question. We are continuing to try to reform and improve the regulations that we have that let us enforce Section 504 or Section 1557 of the Affordable Care Act when it comes to anti-discrimination provisions. We hope that Congress will provide us with the resources our Office for Civil Rights requires in order to be able to do the work to enforce the law when we get reports of violations.
Thank you. I yield back. Thanks.
Mr. Bean, you're recognized for 5 minutes.
Thank you very much, Madam Chair. Good afternoon to you. Good afternoon, Mr. Secretary. Welcome. We're glad to have you here. You say the 85,000 number of children that you've lost is incorrect. You say that it's more like 20% of the 120,000 that are unreachable. Is that a better number to use? 20% of 120 that we can't find?
But let me correct you. We haven't lost any child. We have all the children that are within our care stay in-house. When we assign them after vetting a custodian, that placement, then we relinquish or we lose the jurisdiction to do more with that child. And so we can't lose someone we don't keep track of or have the jurisdiction to keep track of.
But you've said that your agency tries to contact them afterwards just to check in, but you don't have contact with them. You call them unreachable. Is that?
Those efforts that we make are beyond the statutory requirements that Congress has imposed on us. We do that because we think it's good practice to try to reach those children after we've placed them. They're not obligated to respond back to us.
But losing 20%, isn't that that's a horrible record. You're not excited about that record.
It's not that we've lost them.
But you don't know where they are. I mean, they're unreachable. You don't know where they are.
We don't have jurisdiction to keep tabs on them. As I said, this is not like a foster care.
So are you working with? But you're the one that placed them there.
That's right. With a parent.
Are you concerned? I mean, if I lost a kid, I would be really worried about it. And now there are reports that these kids are coming up. They're working in the slaughterhouses, and we don't know where the others are. They could be doing far worse things. I mean, you don't seem too concerned. I want you concerned.
We're very concerned, and I hope you find that compelling enough that you will act to change the law to give for the federal government more jurisdiction to keep account of these kids.
So, but what are you doing differently? So your track record is losing 20% of them. What are you doing differently going forward to say that you can have 100%? Is there anything less than 100% that you would be happy with of taking care of kids?
If you would require that the child or the sponsor stay in touch with us, that would help us. But we don't have the authority to require that. So we can't lose kids that we don't have jurisdiction to keep tabs of.
So what are you doing differently now that you're only having 80%? What are you changing? What are we doing differently?
That's a great question. We're trying to work closer with the Department of Labor because they may spot some trends. And they could say to us, by the way, it looks like in this part of the
Are
country.
you doubling down? Do you give a sponsor more than one kid if they can't? Are we doing more than one kid to a sponsor who doesn't check in and let us know that the child is okay?
We vet every potential sponsor, have them go through all the background checks, make sure that they understand their responsibilities before
I
we
would check
place
that out
child.
because evidently it's not working if you're only doing 80% that are
So
checking
you're
back
conflating
in
two
with
different
you.
things. You're conflating different things. The vetting process has nothing to do with our post-release checks. Those post-release checks are things that we do because we think it's a good thing to
What
do.
number are you going to say that when you lose kids, how many is too many? And you say, you know what, we can't take anymore. We just got too many. We got too many things going on at HHS that we just can't keep track of anymore. Let's get somebody else do this, or let's say that we just can't take any more kids. Is there a number that you would say we can't do anymore?
Well, first, we don't have the privilege to say we can't take any more kids. We have to take a child that's been
But you're okay on not batting 80%, losing 20%.
We have assigned those kids, and once they're assigned,
do COVID
they are the
vaccines
responsibility
prevent
of those
COVID?
sponsors.
Do COVID vaccines prevent COVID? Does that prevent COVID?
Do COVID vaccines help keep people out of the hospital? They help
Okay,
prevent
but they don't
severe
prevent COVID. They don't prevent COVID.
They help
Penn
prevent.
State University says you're 7 times more likely to get myocarditis after taking the vaccine than not taking the vaccine. 7 times, especially if you're a young man. But that doesn't seem to bother HHS. We're still full throttle on telling everybody to get these vaccines. What number or what multiplier will you say, enough's enough, and we need to give warnings to young men who are being still urged to take these vaccines? What number will you say enough is enough?
More than 1 million Americans have died. Many of those young men who have died. How many men have died from myocarditis?
So is there a number? It's a big number. If you got and I
is
know
it
them.
a
They've called
million?
my office.
Is
But
it a
is there a
million?
number that you would say enough's enough? I want to follow the science. You've seen the dramatic rise, the surge, the skyrocketing myocarditis, but you're okay with that?
Yeah. Young men are dying from COVID in numbers that are far greater than anything that could happen with any of the side effects that some of the
I
kids
wish you could
are
talk
feeling.
to some of these families that have myocarditis and deal with that. With that, I yield back, Madam Chair.
Thank you very much. Ms. Wild, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. Secretary, thank you so much for being here. I want to shift gears entirely to a subject that I find of great interest, mostly because it's something that has been highlighted to me by my constituents on so many occasions, and that is the issue of postpartum mental health. And I know that the National Maternal Mental Health Hotline recently updated its number to 1-833-TLC-MAMA, which is great. And as I said, I've heard from so many women about postpartum experiences that have been very, very difficult. And so I'm happy that there is now a 24/7 free telephone line that connects these mothers with professional counselors who can provide emotional support and so forth. For any mother who might be listening in today or might see this hearing in the future, is there anything that they should know about this important resource that your department has provided?
Congressman, thank you for the question. Absolutely, that they should know that if they reach out and call that number, there's a good chance that we'll be able to direct them to services that they can utilize to make sure that they're taking not just care of themselves, but of any family member as well. And so we encourage them to use the hotline to find out what services are available to them.
Well, I promise you, my office will make sure that we are pushing the availability of that number out. It's something that I was not very aware of prior to this. And then I just want to switch gears to the Low-Income Home Energy Assistance Program, otherwise known as LIHEAP, which, for those who are watching, provides federally funded assistance in managing costs associated with home energy bills and weatherization and that kind of thing. And it's something that in Pennsylvania, many families are relying on these investments to lower the cost of staying warm, or in fact, to receiving heat at all in the winter, or staying cool in the summer. The president's proposed budget would allow LIHEAP grantees those funds to assist low-income households with their water and wastewater utility bills, which would be something new. Can you talk about why that would be important and about LIHEAP generally and its successes?
Congresswoman, first I have to thank you and many of your colleagues for giving us the additional resources in LIHEAP to actually reach out and now expand the scope of services. What we're finding is that many Americans are suffering, in some cases dying, because of heat or in some cases because of cold. And what we want to do is make sure that the LIHEAP program is there to help them as best possible in the way they need it. And so for some, it will be an issue of heat. Some, it will be an issue of air conditioning during the summer. Some, it will be making sure they can stay warm and get the type of heating that they need. For other folks, it may be something different. As you mentioned, now water. We're trying to make sure that we don't forget that people have to have access to potable water that's safe to drink. And if you can't drink safe potable water, you're in really big trouble. So we want LIHEAP to work for families where they are, and we will let those on the ground that actually administer the programs determine how best to utilize those LIHEAP resources.
Well, it would seem to make a lot of sense. Most people are aware that energy costs, whether it's gas or electric, to help with air conditioning and particularly heating in the winter is incredibly important. But a lot of people don't think about the necessity of water to every single human being and how expensive it can be. And can you talk, again, getting back to my interest in maternal health and postpartum health, we know that maternal exposure to heat is associated with an increased risk of preterm and early term birth, low and decreased birth rate, weight, stillbirth, and harmful newborn stress. Can you talk about the importance of continuing and expanding the LIHEAP programs generally, especially as it relates to vulnerable populations, and if you could focus particularly on expectant mothers and children?
And I know you know this, my wife who's an OBGYN can tell you this as well, that a woman goes through significant stress during pregnancy. And the last thing you need is to have that stress compounded by a lack of heating or a lack of air conditioning, hot temperatures, or lack of access to potable water. And so LIHEAP should be there to help. And again, let those on the ground who know how best to use the resources with families in their jurisdiction determine how best to use those LIHEAP dollars. And certainly when it comes to maternal health, the last thing you would want is to have a woman who's stressed because she's already pregnant now have to stress more because she doesn't know how she's going to.
And it's not just emotional stress. We're also talking about physical health during pregnancy, right?
Both.
Okay. Thank you very much, Mr. Secretary. I yield back.
Thank you, Ms. Wild. Mr. Burleson, you're recognized for 5 minutes.
Thank you, Madam Chair. In 2018, you were the California Attorney General, correct?
Yes, sir.
And at that time, you investigated, I believe it's called Humboldt County. I'm not from California, so the Department of Health.
I believe so. You'd have to, you're making me go back a bit in history, but I believe you're right.
You investigated them because of systematic issues related to the care of children.
Yes.
Correct? Okay. You obtained a stipulated judgment against that agency, correct?
My recollection is yes.
Okay.
Sorry.
So in your press release, when you announced the judgment, you stated, and I'm going to quote, "The institutions of Humboldt County entrusted to protect children failed them. What can be more important than public agencies performing their duties to safeguard the security and welfare of our kids?" End quote. Do you still agree with that statement?
It sounds like you were reading verbatim, so I would say yes if it's a quote from
I think anybody should agree with this statement. But this is where it comes to the crux of this hearing, which is why so many of my colleagues are asking this question. When we have a whistleblower that appeared before judiciary who stated that 85,000 minors are missing from your agency, now you say it's not 85, you say that it's somewhere around 25.
Well, that's
correct?
completely inaccurate. They're not missing from our agency. We no longer have jurisdiction over those children.
You can't get a hold of these children.
We don't have jurisdiction to get a hold of the children.
Okay, so let me ask you this question. You say you don't have jurisdiction, but yet you bent the law to get jurisdiction to call these families. You're willing to go beyond what your authority is in order to make phone calls. You just stated that in testimony.
Yeah, we didn't bend the law. We went beyond the law to try to see if we could reach these
So
kids.
what you're saying is that it's not important enough to go beyond the law to find out what happened to these children.
No, because we do go beyond the law.
Okay, so let me ask this. Within the law, what your authority is, what authority do you have to place the children with a sponsor?
We do have authority
So
to
you
place
place
the
the
child.
children with the sponsor.
Correct.
How do you decide who they can be placed with?
We usually work with the parents if they are in the home country. We work with the child, especially if they're older, and we try to work to find out who they know or who they consider to be close and could be protective of the child. And so about 1 in 3 of our placements are with the actual parent of the child.
So do you not think that there could be something that you could do in the perimeter of the law that you have purview over to reduce the number of children that you lose track of?
Okay, Congressman, we go beyond the law to try to reach out to them, but we don't lose any child because we no longer have jurisdiction.
You don't know
of
where
them.
they are.
The problem is you haven't given us jurisdiction for us
What
or
I'm
any
saying
other
is,
agency
on the
to find
front
out where
end,
they
why
are.
can't you come up with a solution on the front end to keep track of the children that
Well,
you placed?
We have tried to do what we can through the post-release service calls to try to see if we can find out if they're doing okay, to check in with them. But as I said, they have no obligation to answer the phone or speak to us once they are placed with their sponsor. And so, Congressman, if you wish to change the authorities and give us more jurisdiction or give more jurisdiction to the Department of Labor, I think we'd be more than willing to talk to you about that.
So let me ask
but
you this.
we can't keep saying we lose kids when we don't have
take
jurisdiction.
my time back. Let me ask you this. So I'm going to move on because this is disturbing to me. In 2022, last year, you issued new guidance direction to the Office of Refugee Settlement to make, quote, all reasonable efforts to facilitate access to abortion services if requested by the unaccompanied child. Correct?
Yes, correct.
Okay. So my question is, when you are handling these unaccompanied children, what efforts are you taking to ensure that they are separated from the individual that, if they were involved in an assault of any kind, or they are being used for sex trafficking, do you not see that the impacts that you're having, that you could have to a child who is basically captive in sex trafficking, and you're enabling their captors to be able to help them get an abortion so they can get back to work?
So again, Congressman, you're conflating two different things and coming up with a question that
So my
doesn't make
question
sense.
is, if you're keeping track of these children,
we aren't,
you would know.
If they are in our care, we do keep track of them because they are in our custody. But once they are placed with a vetted sponsor, we no longer have custody. We can't keep track of them because they have no obligation to stay in touch with us.
So turn a blind eye.
No.
You don't know. You don't have the authority.
We don't have the authority.
But you're going to make sure that they
we
have
don't turn
access
a blind
to
eye,
abortion
but we
services.
don't have the authority.
Okay. Thank you. I yield back.
I appreciate that.
Thank you. Ms. Leisure-Ferdinand, you're recognized for 5 minutes.
Thank you, Madam Chair, and thank you so much, Secretary Becerra, for joining us here today. I truly appreciated, as we opened our hearing today, your summary of how both congressional Democrats and President Biden and his administration have worked to actually bring down the cost of prescription drugs, have worked to make sure that more people have access to health care. And while we've been doing that and so much more for American families, rural communities, and just this country in general, we have done so much. We've also been doing it at the same time that we've been reducing the federal deficit by $1.7 trillion in 2 years. So the right administration, Democrats in the Senate and House, leads to both fiscal responsibility and paying attention to what our families need. But I represent rural communities. You've been out to my district, and there is a huge need for better health care and better access to resources. I want to talk about one of the little problems, and that is that it's often very difficult for these smaller communities, these smaller organizations, to actually apply for competitive grants for alcoholism, substance use disorder and treatment, and those kinds of things. We have organizations that say, I have to pass up this because I don't have the capacity. And so I am constantly asking, what can the administration, what can HHS do to provide the assistance so we get those kinds of projects and programs actually operating in our smaller rural and frontier communities?
Congresswoman, thank you for the question, because you're right. It is difficult to compete against the big guys, especially when you're in a distant location. We are trying to work closer with rural America to try to make some of these resources available. Some grants are designated to go into rural America. We are working very hard to try to keep some of the authorities and services that have really helped rural America. For example, telehealth, which was one of the greatest godsends for men and women, families in America, rural America, who during COVID could not really go visit physically their healthcare provider. Telehealth has been instrumental in helping a lot of these families stay in better health. And so we're going to do everything we can to try to help in that regard. But you're right, when it is a competitive grant, Congress, you all determine how that grant is administered. We try to make sure everyone can be competitive. So we do, for example, offer training and assistance for those who wish to compete for some of those grants so they can try to compete against the big guys.
Right. And the more assistance you can provide sort of from the executive on that would really be helpful so that we can have more of the rural areas. I mean, this administration and Congress last cycle did so much for rural America. I put together pamphlets so that I could go out into my district and say, look at everything we've done in rural America. Part of the problem that we still need to look at is rural hospitals. Like too many hospitals in rural America are closing their OBGYN or cutting their hours. And I know we have the new Rural Emergency Hospital designation, which is going to be very helpful as it increases Medicare reimbursement. But I'd love to brainstorm with you a bit about what else can we do, because hospitals that provide inpatient care are ineligible for 340B, which is a major source of funding. So do you have some ideas on how we could increase the success of our rural hospitals?
So we've already had plenty of discussion about 340B and how we have to try to preserve it, but take away the elements that keep prices from coming down and being utilized by more providers. What I would say to you is one thing. I would love any member who would take me up on this offer, and that is to try to make sure that our graduate medical education slots, the residency slots that are used to train upcoming physicians, that we're able to place more of these in places like rural America, inner city America, because what we're finding is that if a budding doctor goes through his or her training in a particular location, after 2 or 3 years of that residency, there's a good chance that they like where they've been working and they will stay. And now you have created a new resource for those communities in rural America, for example. And so we're trying to direct where we can a focus on underserved areas to place some of these graduate medical education slots. We're also, for example, trying to beef up the number of slots we have in our Public Health Service Corps, where if you commit to provide 5 years of service as a doctor after you graduate from medical school and residency, we will pay for your medical education. My son-in-law is right now practicing in Salinas, California as a pediatrician. He got 4 years of medical school paid for by the federal government, but now he's committed to serve in that underserved area of Salinas, California for 5 years.
Thank you very much, Mr. Secretary, and I really do appreciate how we are having a rural focus with this administration. Thank you.
Mr. Williams, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. Mr. Secretary, I'm very disappointed in the evasive nature of your answers here today, particularly on our side of the aisle. But in reviewing your background, I see that you spent 24 years in this chamber and serving in the House, and also that you are a lawyer. So the fact that you bring politics and law into this conversation instead of a medical background and medical expertise, I think explains very much the nature and lack of answers in your questions. I'm an engineer. I come from a very different sort of background, very new to this whole environment of politics, and I find it astounding that this charade of answers and is allowed to continue. I'll just give you a few examples from your testimony today. And again, this could only be crafted by the expertise of of someone with your background, where quite often you talk about that your department goes beyond the law to provide these heroic services, and in the same breath you'll say you don't have jurisdiction. And so, which is it? Because what I have noticed when I go back home and talk to ordinary Americans, that they are incredibly frustrated with people that do not answer directly. There are real issues that the American people want to know. For example, the learning loss and emotional harm done to children as young as 2, forced to wear masks by your department under your leadership, and yet you won't provide an answer. These are parents of small children that are dealing with the fallout, and yet you choose to play games and you choose to evade direct questions. This is what frustrates America about this town and about an administration that puts politicians and lawyers in charge of health care. That's not the kind of leadership that the American people expect. And I find it shameful. And frankly, I find it shameful because I come from a different discipline. On a nuclear submarine, you don't have that option. There are no sea lawyers on submarines. They do not send us out. I understand that the Soviet Union did, that they sent political officers out with their submarines, not necessary on Americans, on American ships, because we are always interested in getting the job done. And that's exactly what the American people expect. And that is nothing similar to the nature of your answer, sir, or your disregard for this body, where you served for 24 years. And I do want to point out that the American people are watching, and they expect answers. So why did you continue a policy of requiring 2-year-olds to wear masks in the classroom and out on the playground? And what medical benefit did that provide?
I hear a question, so you want me to answer the question about
That's a question.
So as I've said before, Congressman, what we try to do at the Department of Health and Human Services, because we don't operate child care programs, we don't operate school classrooms, we try to provide
this evasiveness of Head Start funding, that if you don't require children to wear these masks, comply with our principles, we'll cut off funding. You're saying that's not coercive? You're saying that you, on the one hand, you don't have jurisdiction. This is exactly what I'm talking about. And then on the other hand, that you have this stick that you use with funding? That is so disingenuous, sir. And I will tell you, the American people see through it, and they're sick of it. Do you care to answer the question? What medical benefit was there to masking children 2 years old in the classroom and on the playground? Sir, a medical answer, not a legal answer.
I will give you, Congressman, the answer that we got from the medical experts that guided the policies that HHS put forward. And that is that the best precautions that we can take to prevent COVID infection are things like masking, distancing, making sure you're washing your hands,
2-year-olds,
getting vaccinated.
2-year-olds.
Every American can benefit.
Everyone
every American
equally
can benefit from these precautions.
And
No,
that's
not
scientific,
equally.
sir.
There I would agree with you. There are studies that show that some benefit more than others. Obviously, if you're
Aren't you paid, sir, to have the judgment in your area of leadership to provide that kind of counsel that, hey, maybe that children under 5, that's not necessary? Isn't that your purview? Or is that maybe, what did you say, not in your jurisdiction? My time has expired, sir. I hope you will be more forthright in the future. Thank you.
Ms. Manning, you're recognized for 5 minutes.
Secretary Becerra, I want to thank you for your service to our country. I want to thank you for your valiant attempt to answer actual questions in the hearing today. And I also want to thank you for trying your best to save lives during the global pandemic with all the information you and all the medical professionals had at the time, for your attempt to save young lives and old lives and everybody in between. I also want to thank you for visiting my district, where you attended a roundtable with my constituents to listen to them talk about the importance of federal funding for federally qualified health centers, which provide critical health care to the most vulnerable among us. And I want to thank you for attending a roundtable on the devastating impact of the Dobbs decision on reproductive health care for women, not only on the freedom of women to decide whether, when, and with whom to have children, but also the negative effect on women seeking care for miscarriages, and hearing from physicians in my district about how they are handicapped in their ability to provide the best care to their patients because of confusing and restrictive legislation passed by extreme state legislators in the absence of federal legislation that is so dearly needed to protect women's health care. As you stated to my colleague, Ms. Bonabici, pregnant women are more than 3 times more likely to die during pregnancy in states that enact abortion restrictions. This is an appalling outcome, and this Congress should be taking action to protect the health of women and girls in this country, not standing by while women and girls' lives are being put at risk by extreme politicians. Secretary Becerra, even before the Dobbs decision, the Trump administration took many harmful steps to undermine access to reproductive care by allowing employers to evade the Affordable Care Act's requirement to cover contraception without imposing cost sharing on individuals. Earlier this year, HHS, DOL, and the Treasury proposed rules to roll back these harmful actions while creating a new pathway for women to receive contraception when their employers seek religious exemptions. Can you talk about how the proposed rules will expand access to contraception, and also tell us what HHS can do to ensure that insurers comply with federal law and cover contraceptives?
Congresswoman, there is no doubt that without contraception services, we would have far more difficult pregnancies. We would have many more cases of families that are in dire needs. And what we find is that contraceptive services, which are usually undertaken by a woman after consultation with her medical provider, an expert, and in consultation with those who are trusted advisors, help us make sure that when we see a family ready to grow, it's because they've really been working to plan that. And so we're going to do everything we can to make sure that contraceptive services are available, that the information and counseling that a woman should have so she can make the right decision is provided to her. And certainly we'll do everything we can to protect the rights of that woman to receive those services. And if anyone attempts to prevent that and discriminates against that woman, we will take whatever action we can to enforce her rights to be protected against discrimination.
Thank you. I'm going to change topics here. You said earlier to Mr. Desalegn that mental health should be put on par with physical health. You were talking about the mental health crisis in our schools. And I just want to mention that I am trying to do that with my mental health wellness in schools bill, which would put mental health services and information on par with physical health and healthcare and services. So the most recent CDC report did outline a severe decline in students' mental health after the pandemic, and particularly mental health issues faced by teenage girls. In the president's budget, HHS requested $90 million for its school behavioral health program, What Works in Schools. Can you walk us through this program and talk about how it will help combat youth mental health problems?
Congresswoman, as you're aware, the mental health challenges facing our young people are growing dramatically. The closer we can get to providing that care where they are on a daily basis would help them. And so we're going to try to work with schools as much as we can to make those mental health services available to all those young people.
Thank you. My time is about to expire, so I will yield back. Thank you so much for your service.
Thank you.
Thank you, Ms. Manning. Ms. Houchin, you're recognized for 5 minutes.
Thank you, Madam Chair. Thank you, Mr. Secretary, for coming to testify before us today. Nearly 3 months ago, I sent a letter to the Center for Medicare and Medicaid Services concerning your department's intent to impose a minimum staffing ratio on nursing homes in the coming months. This administration chooses not to cooperate with congressional communication. I'd like to take the opportunity to discuss that issue with you today. As you know, long-term care facilities are still recovering from the COVID-19 pandemic as they try to backfill open practitioner positions during a national workforce shortage. According to the Bureau of Labor Statistics, Indiana's long-term care facilities had over 46,000 practitioners in February of 2020. As of 2022, that number fell below 40,000. Now, just last week, I had constituents in my office explaining to me their concern on how this rule will hinder their ability to care for patients. Mr. Secretary, why am I still hearing from providers that HHS and CMS are unwilling to consider and discuss their concerns?
Congresswoman, please, if there are particular providers that believe that HHS and CMS have not been willing to speak to them, please let me know who they are, because we have reached out to providers throughout the country to talk about the staffing levels of nursing homes. And,
okay, we will do that.
Great.
If this rule is to be introduced, the providers in my district have made it clear that long-term and post-acute nursing care facilities will be unable to provide continued care in rural areas such as the district that I serve, and that's quite frankly unacceptable. It will push patients to unnecessarily higher levels of care, costing already high-cost programs, driving those costs even higher, not to mention the fact that the higher levels of care are not always optimal for these patients. Instead of implementing a top-down rule that will force providers to increase their staffing minimums, I encourage your department to take time to meet with these providers and consider how we can best support their success, particularly as they're still recovering from the pandemic. I'd like to discuss another example, moving on, where your department is, in my view, just not listening to the providers. Of more than 6.7 million patients with Alzheimer's across the country, more than 110,000 of them are Hoosiers. As you know, the FDA has approved monoclonal antibody treatment created in Indiana that has demonstrated it can slow down Alzheimer's for individuals with mild cognitive impairment. Medicare has traditionally covered all FDA-approved drugs, yet it has continuously chosen to not allow for unencumbered access to Alzheimer's treatment. Why is this, Mr. Secretary?
Congresswoman, I've tried many times to explain this because I myself, my wife, we've all gone through this. I suspect maybe you have as well, where someone in your family may have been afflicted by Alzheimer's or some other form of dementia. It is very difficult. And I appreciate and applaud all of those people who are trying to push as aggressively as possible to get the kind of care that would help their family members get better. But where I think I have to try to explain is constantly is that once the Federal Food and Drug Administration takes action and says a particular medicine can be put out for consumption because it will be safe and effective, the decision then becomes on the Medicare side whether or not that drug will be listed as part of the medicine.
So what is the answer? Why is that not available to those patients?
Because the standards are different between what the Food and Drug Administration uses to determine to put out a drug and what CMS determines whether or not to include it within Medicare.
Why is that?
Because by law, Congress passed a statute that says FDA treats its work with a different standard than CMS. So because FDA has done its work doesn't mean that CMS automatically then takes what FDA did and uses it for Medicare.
Those living in rural districts such as mine are more likely to be affected by this if the CMS policy for coverage with evidence development moves forward. The logistical challenges for patients and caregivers alike, as well as healthcare providers in these rural areas, it will make it increasingly challenging to meet the needs of those patients. Are you willing to consider that CMS could reevaluate the current policy of requiring coverage with evidence development for this class of therapeutics?
CMS, as we're speaking, is doing an ongoing reevaluation because once the information that they get is sufficient for them to say, we now have passed the bar to include that drug within coverage within Medicare, they will announce that. So it's an ongoing process within CMS.
I urge you to allow for the immediate access to FDA-approved treatments for patients that would benefit from these important therapeutics, just as it does for all other classes of FDA-approved medicines. I won't stop advocating for improved health care in rural areas. I worry that continued suboptimal performance will continue if HHS leadership does not make meaningful changes to those affected in rural districts. Madam Chairman, I yield back.
Thank you. Ms. Omar, you're recognized for 5 minutes.
Thank you. Secretary Becerra, it's really good to see you. My daughter, who welcomed you to her school the other day, sends her greetings when I told her that you'll be coming to testify. I wanted to talk to you about drug pricing. I know that we did an incredible job with the Inflation Reduction Act. It was a historic effort to reform and improve the affordability of health care, and many of my constituents and seniors are particularly excited about the fact that there is a law that would also place an out-of-pocket limit on senior drug pricing and require drug companies to provide rebate when they raise their list prices faster than the rate of inflation. Many of them are also excited that you now have the ability to negotiate prescription drug prices. So I wanted to ask you, how are these tools, these new tools that we provided, going to help you do just that, lower the cost for people on Medicaid?
Within the Medicare program, it is working tremendously well. It's going to help us if we can get people to understand what benefits they now have. Some people still don't recognize that they're not obligated to pay more than $35 for their month's supply of insulin. Many people aren't aware that they won't pay a penny anymore for a vaccine for, say, shingles, which can cost between $200 and $300. So one of the things we're really working on is communicating more, reaching people, going to districts of members of Congress so we can work with you to make sure people understand what these new benefits are in the president's new prescription drug law.
Mm-hmm. As you know, the Administration for Child and Families hosted its annual tribal consultation, and they were able to look at policies and priorities. In June, can you talk to us a little bit about this important gathering?
At the Department of Health and Human Services, we do consultation with our tribal partners. We believe that sovereignty is an important pillar of tribal governance, and we work closely with our tribal governments to make sure that we know where they would like to see HHS go, our Indian Health Services. And so we engage in very robust consultation with tribal leadership to make sure that when we are putting out policy, it is with the understanding that Indian country is supportive and on board.
And as you know, approximately 7% of all American Indians and Alaska Natives live in urban and suburban areas. Can you also speak to the importance for the department as they do this consultation, and what are they willing to do in order to communicate with urban Indian communities and organizations?
We consider very important the voice of tribal members who live in urban communities and may not live on tribal land. And we have mechanisms to make sure that their voice is included in all of these consultations, because we want to make sure that when we say Indian country, we include every member of a tribal community, whether or not they live on tribal territory.
As someone who represents the largest Native urban communities, I really do appreciate that. That's important. I wanted to switch gears and talk to you about this report that came out from HHS Inspector General's office about the failures of state of child welfare agencies to properly report missing children to the National Center for Missing and Exploited Children. It was shockingly 76% of the missing children were not being reported in accordance with federal requirements. Of the 69%, 47% of the missing children during the audit period were never reported to NCMEC at all. The IG recommended the Administration for Children and Families work with state agencies to ensure proper compliance. It looks like ACF agreed. Can you give us an update on the agencies and how they're dealing to address this issue?
Thank you for the question, Congresswoman. Yeah, we are trying to move forward in adopting many of the recommendations by the Inspector General. We would like to be able to work as closely as possible with the local agencies that are the enforcers of child welfare laws. We want to make sure that every tool that we have that we can put at their disposal, resources as well, we advise them of. I suspect you'll find that many of these local agencies are very stressed, understaffed. We'll do everything we can, and with your support, we might be able to get the resources and authorities to work closer with these agencies to make sure all children are protected.
And I'll be following up with you on that. Thank you, and I yield back.
Thank you. Ms. Chavez de Reamer, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. Secretary Becerra, thank you for coming today. As some of my colleagues have mentioned, your impatience to place undocumented children with sponsors at a faster rate than your caseworkers could handle placed thousands of kids in dangerous conditions where they were exploited for labor. Kids as young as 12, some even died. This is a chilling failure of leadership, but the President has decided to keep you on board, as we have an obligation to the American people to work together. So let's make sure this never happens again. Yes or no, do you commit yourself and your staff to working with me and committee staff on this issue that includes providing us materials which can educate us as to how the sponsorship process has been abused?
Congresswoman, thank you for the question, and we have been working directly with the committee and members on this committee in the past. We look forward to working with you to make sure that we are doing everything possible to protect the children who are in our care.
Have you reviewed how to improve the vetting process for sponsors since the New York Times story, and what improvements have you made to date?
Congresswoman, we've been reviewing the vetting process since I became secretary, because it's an ongoing process. The circumstances have changed, as you would know, very dramatically. In 2021, there were large numbers of children in our care. Today, the number is greatly smaller. And so what we're trying to do is constantly be on top of what it takes to make sure that we care for the kids who are in our temporary custody well, but we also make the right placements once they are able to go out into the community.
Okay, so with that being said, you've concluded which areas do you think Congress needs to address? And aside from comprehensive immigration reform, which we're already doing that with the Dignity Act, well, tell me, where can Congress help you?
I appreciate the question. And there's a very simple answer to that, because many of the questions many of your colleagues have asked are, why are we not accounting for children? I keep trying to explain that we only have jurisdiction based on what Congress has given us. Someone has to be able to account for these kids in a better way, these migrant children who are ending up working in these exploitive conditions. We don't have the authority to check up on them, to follow up and require them to check in with us, as a foster care program might have with a U.S. citizen child. If you want to help us, make sure that someone in the federal government, maybe it's not HHS, maybe you decide it's the Department of Labor, maybe you decide it's done through the states, but there's a gap. When we have the kids in our custody, they're not exploited in the labor workplace. Once we place them with a parent or a close relative, we don't have jurisdiction. Who will make sure that they're accounted for or taken care of? There's the gap. And I would hope that rather than make accusations, members would try to work with us to make sure that if they really care about kids, we are making sure that they're accounted for. Who has jurisdiction?
So let me add on to that. Talk to me a little bit about the child labor space. Within your department's jurisdiction, what areas would you be willing to partner with me and the committee to strengthen those guardrails needed to protect these kids?
We can work with you right now we're working with the Department of Labor. They're trying to give us any signals if there's some signs that a particular person who might want to sponsor a child, or in particular areas of the country, we see that type of exploitive behavior. If we get that information early, we can have then the red flag go off if someone is seeking to sponsor a child who fits that profile or lives in that area. We can work with you if it happens to be in your congressional district, or if you're interested in helping us merge and better tie the work that the different agencies can do. And then where you really can help us, get the local agencies, the state and local agencies, the licensing care facilities at the state level, the community organizations that work with families, migrant kids, to work closely with you and with us to make sure that we're all trying to do this seamlessly, so there is no gap in who's accounting for these children.
Thank you. I think there's little words that can describe the anger that we all felt when we read the New York Times story and when it broke. We do feel like there was a betrayal of trust for our most vulnerable kids. in this country. You know, they're surrounded by those strange faces. And I just can't imagine that for my own kids or anybody else's kids. So I do expect that I will work with you, but I do expect that you'll honor those commitments that you've made to me today. And with that, Madam Chair, I yield back.
Look forward to it.
Thank you. Ms. Jayapal, you're recognized for 5 minutes.
Thank you, Madam Chair. Thank you so much, Secretary Becerra, for joining us today. Your work to promote health affordability and health equity from your time here in Congress as a member of the House, to your tenure as Attorney General of California, to your current work leading the Department of Health and Human Services for the administration has just been vital to our progress, and I am deeply grateful to you. The contrast between the priorities of my colleagues across the aisle and Democrats could not be clearer. When Democrats controlled the House, we passed bills that gave people the freedom to get the health care they need by expanding coverage and lowering costs. Now, this majority is pushing bills that continue to take away the right to health care, including gender-affirming care and abortion, while doing absolutely nothing to lower costs for patients. Secretary Becerra, my Republican colleagues have proposed federal bans on gender-affirming care, and more than 19 states have passed bills restricting care. What do medical experts say about the importance of access to gender-affirming care for transgender people?
Congresswoman, it is long-standing medical practice to offer gender-affirming care. It has been shown to not only provide for the physical health care needs of an individual, but the mental health care needs of individuals. And so whether it is because the science has shown us that it works, or whether it's because through practice we have professionals, doctors who can tell you how it's worked, we know that gender-affirming care has helped us bring some level of comfort and a better life for so many Americans who are in search of gender-affirming care.
And in fact, isn't it true that there's a long list of medical associations that endorse gender-affirming care and the positive health effects that gender-affirming care has for people with gender dysphoria?
That's correct.
There has been an increase in violent rhetoric and threats against transgender people and their doctors, including at children's hospitals that provide gender-affirming care. For example, Boston Children's Hospital received a bomb threat resulting in a lockdown. Secretary Becerra, how do you predict that this will impact children's mental health and safety?
Congressman, I think it's very obvious. If you see on the news that there are bomb threats, there are attacks, there's violence committed against those who are trying to help an individual who needs gender-affirming care, you take on the burden of saying, it's because of me that that person may have been attacked or harmed. And you also recognize that that could be me next, because they're attacking that person because of the care I need. And so the kind of stress that that imposes on any individual, including a young person, we can only imagine.
I know that HHS has taken action to address and increase critical care for trans youth. I want to thank you for that. Can you tell me a bit about your efforts to improve access to quality mental health care for trans people and trans youth, and why this has better outcomes for trans youth than removing their right to medical care?
Well, first and foremost, every American is entitled to get the health care that they need. And so transgender Americans are no different. And so we are doing what we're doing because it's their right. And we have an obligation to defend their rights and protect their health care interests. At the same time, we know that the closer we can get to providing them with that care, for example, in a school, the more likely that the child will have good outcomes, not just in terms of health, but in school and moving forward in life. And so we're going to try to put that care as close to that individual as we can.
Well, I really want to thank you, Mr. Secretary. I think you know I'm the proud mother of an incredible trans daughter, and I have watched the role that good medicine has played in her life and good care, healthcare has played in her life. My heart breaks for parents that are in states that have banned this evidence-based, life-saving medical care that kids need, and for those who face these coinciding increases in violent rhetoric against trans people. I am deeply concerned that this Republican majority continues to make this a priority for their time leading the House, restricting the freedom of families to make healthcare decisions over taking real action to tackle our healthcare crisis. Seems to me that if we did a poll across the country and asked Americans what they would want us to focus on, it would be on lowering the cost of prescription drugs, on lowering the cost of basic health care, making sure that seniors can get dental, vision, and hearing, other things that are critically important, not banning gender-affirming care for so many young people and trans people across this country. I want to thank you for your leadership. I yield back, Madam Chair.
Thank you, Ms. Jayapal. Mr. Scott, you're recognized for 5 minutes.
Thank you, and thank you, Secretary Becerra, for being with us today. It's been a long day. Just first, a quick assurance. Can we count on you to continue to follow the science and CDC recommendations in response to COVID-19 and any future pandemic in terms of vaccines, masks, and other recommendations, including how they might affect children 2 years old or under, and ignore the politics and misinformation?
We will follow the science, and we will try not to let the politics get in the way.
Thank you. Notwithstanding the court situation, are prevention services still available under the Affordable Care Act?
Yes, they are.
We've heard a lot about religious discrimination. Some view the victim of discrimination, as I do. If you apply for services and a provider won't provide you services because of your religion, you're the victim of discrimination. Others have kind of turned it around, that if a provider has to provide you the services, if he doesn't want to because of your religion, the provider becomes the victim of discrimination. Can we count on the patients who are seeking benefits under HHS-funded programs, to the extent possible under the law, to be free from discrimination?
Absolutely. If you are entitled to receive a health care service, we're going to defend your right to get it. And at the same time, whether it is because of your ethnicity, your race, your religion, your religious values, that someone is trying to deprive you of your rights, we will try to defend that as well.
Thank you. We've signed up over 16 million people in the Affordable Care Act. Are there any ongoing barriers to signing up that we need to address?
Congressman, there's always some impediment. Rural America, tough to get to people everywhere. In urban areas, we still have a lot of disinformation and not enough information about what the benefits are. And so we're going to continue to go to where people are instead of waiting for folks to come to us. That's how we were able to have such success in getting more than 60 million Americans enrolled in Obamacare.
Thank you. We've had a lot of discussion about unaccompanied children. Excuse me. Let me first, you've identified sponsors. What do the sponsors promise to do?
In order to sponsor a child, they must commit to protect the health and welfare of that child. They must provide for the safe housing of that child and make sure that the interests of the child are promoted. So if the child is of school age, the child has an opportunity to go to school. And so they are essentially committing to be the guardians, the custodians of that child during this temporary status while they're going through their immigration proceedings.
And that's a temporary placement while they're going through the proceedings?
That's correct.
And does the department provide any services during this time?
We, by law, by statute, we lose jurisdiction over these children once they are placed with a vetted sponsor. We do try to follow up with phone calls to the child and to the sponsor, but as I continue to point out, they don't have an obligation to respond to us because we don't have jurisdiction, but we try to make an effort to at least follow up to see how the placement is going.
Well, you've described this as a gap. What agency would be the appropriate agency to have continuing jurisdiction?
Well, that's a great question, because remember, this is not like a foster care program where the state has custody of a child and places that child with a foster parent or home, where the state continues to hold jurisdiction over the child. So if things don't go well, the state can take action. because these children are here under a temporary status while they're undergoing their immigration proceedings, and because they've come in without an adult guardian, we are caring for them temporarily until we find a sponsor who says, we'll take over that responsibility. The gap exists because there's nobody then who oversees that sponsor. And there's where Congress would have to give us or someone else
And
authorities.
if we gave that responsibility, would we have to provide some funding so that you could actually fulfill your responsibility?
Without a doubt.
Thank you. Madam Chair, I ask unanimous consent to submit for the record a letter from the Centers for Medicaid and Medicaid Services regarding the waiver it afforded St. Francis Health System to maintain its chapel candle so long as it took reasonable measures to mitigate fire risks. This letter corrects the mischaracterization of my colleagues concerning this issue.
Without objection. Thank you, Mr. Scott. Mr. Secretary, I wrote you on December 22, 2022, about our concerns about HHS policies about children who identify as a gender that's not their biological gender. Specifically, I expressed my concerns about parental rights not being respected in basic decision-making about life-changing treatments and surgeries. You failed to respond timely or completely. I again wrote to you on January 12, 2023, to request you provide timely and complete responses. You responded, but Mr. Secretary, you neither fully nor completely responded to my questions, and particularly my document request. Will you commit to providing timely and complete responses to my questions and documented requests to my letters of December 22, 2022 and January 12, 2023? Yes or no?
Madam Chair, we will work in good faith with you to try to address any requests that you make in your oversight capacity.
Will you commit to providing timely and complete responses to all letters I send you henceforth?
Congressman, we will, again, work with you closely and certainly in good faith to try to address any requests. As you know, the longstanding practice in the executive branch is to try to respond to the requests of the chairs of the committee so we can make sure you have that information.
You're going to need to work just a tad harder to comply. Mr. Secretary, in my earlier letters to you, I noted how the family is the most basic unit of society, and parents have the inalienable right and responsibility to educate and rear their children. Yet there are examples around the country where Child Protective Services have taken children from the homes of loving parents because parents do not support life-altering surgeries or other medical interventions on their children who have been diagnosed with gender dysphoria. In California, one parent lost custody of her daughter, and court permitted only 1 hour of visitation each week because the mother did not want her daughter to receive gender interventions. In Ohio, a husband and wife lost custody of their 17-year-old daughter because they would not consent to cross-sex hormones. Instead of standing up for parents, the Biden administration has pushed to make it easier for children with healthy bodies to access puberty blockers, cross-sex hormones, and life-altering irreversible surgeries. I'm saying children. HHS has even weaponized its Office for Civil Rights to threaten providers and health plans that refuse to assess children diagnosed with gender dysphoria in receiving surgical or hormonal medical interventions. What planned regulations and guidance documents do you have under consideration for the Child Abuse Prevention and Treatment Act, Family Violence Prevention and Services Act, and child care programs that will discuss policies related to gender diverse, gender minority, or transgender issues?
Congresswoman, that was either a very long question or I missed the actual question in the comments.
What regulations and guidance do you have planned under the legislation, Child Abuse Prevention and Treatment Act, Family Violence Prevention and Services Act, and child care programs?
We will do everything through regulation that we can to make sure we can enforce the statutory provisions in those acts to make sure that we're protecting every individual that's entitled to those protections under those new laws. We'll do everything for a transgender child that we would do for any child because they have the same rights to access care that they need.
You mean you're going to protect children who have one biological sex and may think that they have a different biological sex? So what's your estimated timing for such regulations and guidance?
Congresswoman, I can get back to you on that because I can't say that there's a particular time frame, but I would say that gender-affirming care is a standard of care that's recognized by every major medical association in this country, and that means that you're talking over 1 million providers who have been part of that process of affirming that type of care. And so what we're going to do is make sure that when it comes to implementing the laws that you and your colleagues have passed, that we do it without discriminating against any group and we protect every individual.
It's unfortunate that you don't have the same feeling about protecting the lives of unborn children so that they would have the chance to be born and live life. Mr. James, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. Good morning, Mr. Secretary.
How are you?
Or I guess it's afternoon now. Good afternoon, Mr. Secretary.
Okay.
Secretary Becerra, the State of the Union this year, the President of the United States of America stood on the House floor and lied to the American people. He stood on the floor and said the Republicans wanted to take away your Social Security and Medicare. In reaction to these lies, I proposed H.R. 875 to divorce the debt negotiation proceedings from health care so that our seniors were not used as pawns in that negotiation. But as a result of these lies, I get comments back from my constituents. One from Rochester Hills who writes, Rep. James, I'm concerned about the debt negotiations that were underway in Congress and they could jeopardize current and future Social Security and Medicare benefits, which I rely on. Another of my constituents from Sterling Heights wrote in saying, it's outrageous that some are suggesting cutting Social Security and Medicare in the debt debate. I've heard a lot about misinformation in this hearing today, but the greatest purveyor of misinformation in the past few months has been the Biden administration. There's been a lot of fear-mongering, and to establish the trend, the White House also lied about cuts to VA benefits. I'm a combat veteran. I have felt the sting of not only the physical wounds of war, but the unseen wounds of war. And the increase above the president's budget of over $18 billion that went to that VA has invalidated that misinformation from this administration. Mr. Secretary, what also concerns me, in addition to this misinformation from the Biden administration, is that it seems to be more concerned with expanding government-run programs when free market options exist to bring down the cost of health care. Many of my constituents are asking me, why must the government continue to spend more and more and more to force them, to make them beneficial, rather than supporting free market alternatives that could at least alleviate a little bit of pressure on the taxpayers to foot the bill, while also increasing quality and choice? Right now, my understanding is Medicare Part A is expected to go insolvent in 2031. Is that also your understanding?
Medicare Part A will face a challenge unless Congress, you all act to provide it with more resources, yes.
Do you believe that Congress should act to maintain the long-term stability, security, and sustainability of Medicare?
Yes, of course. And the President provides a proposal to do so.
Would you agree that increasing expenditures has put us in this mess in the first place? Hey, I'll even credit you. Both administrations, Democrat and Republican, spending without controls, without checks, and without commiserate attention to the nutritious and environments that we're putting our people in. Do you believe that spending in Democrats and Republicans have put us in a situation where Social Security and Medicare could go insolvent within our lifetimes?
Well, Congressman, as you know, Social Security and Medicare don't rely on what the budget that you pass on a yearly basis does, because Social Security and Medicare
Okay,
operate
so
on their own
irresponsible
terms.
fiscal policies. Do you believe that irresponsible fiscal policies have put us in the position where our seniors now and in the future are at risk? And do you believe that Congress and the administration have a responsibility to fix that?
Fiscal policies must be enacted that keep the interests of our families in mind, but Social Security and Medicare operate on their own terms.
Do you believe that Congress and the administration have a short and a long-term responsibility to get Social Security and Medicare back on the right track? Yes or no,
I would
please?
hope that you would act to make sure that we keep Social
Okay, I'm
Security
going
and
to assume that's
Medicare
a no.
working well for
Unless
everyone.
it's a yes. I don't want to put words in your mouth. Okay, I'm going to assume that's a no. Madam Chair, before I conclude, I don't want seniors to lose their benefits, and I'm going to do everything I can to protect seniors' benefits. With that, I yield.
Thank you. I would like to thank the Secretary again for taking time to testify before the committee today. And without objection, there being no further business, the committee stands adjourned.